गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि.
Good evening. A very warm welcome to all the respected dignitaries, seniors, colleagues, and all the attendees on the MAHAIAP YouTube channel. Friends, tomorrow 19th June is observed as World Sickle Cell Day, and the theme is Shine the Light. Today, MAHAIAP has arranged a special quiz competition in which, for the awareness of the thalassemia and sickle cell disease, today the Gynec and Pediatric Society both has come together for this special awareness quiz competition. And now I would like to welcome Dr. Amol Pawar sir, our Secretary General, for the welcome.
Thank you, Neha. On behalf of MAHAIAP, I welcome all the dignitaries, Dr. Rajendra Singh Pardeshi sir, who is President of AMAUGS, Maharashtra, and Dr. Chetan Shah sir, Vice President of Central IIP, Dr. Upendra Kinjodekar sir, President-elect of Central IIP. I welcome all the gynec and pediatric friends across Maharashtra, which are in 6 teams. I now will announce the teams as follows. The first team is from Mumbai and Konkan region. The gynae friends are Dr. Shailendra Jadhav from Thane, Dr. Rajendra Chavan from Palghar. Then there are 3 peds in that Mumbai team. Dr. Amit Jain from Mumbai, Dr. Amit Saxena from Navi Mumbai, Dr. Sunil Seth from Raigad. Then second team is from North Maharashtra, Dr. Mugdha Bhamre from Malegaon, then Dr. Chandrakant Sanklecha from Nasik. Then pediatrics friends are Dr. Yogesh Salunke from Dhule, Dr. Ganesh Mane from Ahmednagar, Dr. Rahul Patil from Jalgaon. Then third team is from Western Maharashtra. First team gynecologists are Dr. Kishore Kesarkar from Kolhapur, Dr. Nisha Hussain ma'am from Sangli. Then pediatricians are Dr. Amruta Shivchan from Kolhapur, Dr. Shailesh Patil from Karad, and Dr. Lakshman Kadam sir from Satara. The Western Maharashtra second team is gynecs are Dr. Sumit Chamaria from Solapur, Dr. Kanchan Durukar from Pune. And pediatric members of this team are Dr. Parag Mahankar from Pune, Dr. Sudhir Azbe from Pandharpur, Dr. Saurabh Mutha from Baramati. Then the Marathwada team is gynecologists are Dr. Prarthana Deshpande from Aurangabad, Dr. Anil Sakhare from Nanded, and pediatricians are Dr. Sachin Jetlia from Bid, Dr. Shilpa Dadge from Latur, and Dr. Nandakishore Palve from Jalna. The last team from Vidarbha is from Nagpur. Gynecologists are Dr. Seema Dande, then from Amravati, Dr. Suyoga Panath. And pediatricians of this team are Dr. Sachin Patil from Yavatmal, Dr. Sachin Ghatod from Akola, and Dr. Sagar Karotkar from Wardha. I welcome all the participants of this quiz. I now hand over to Dr. Neha Singh. Thank you.
Thank you, sir. Now I would like to call upon our President, Dr. Hemant Gangulia, sir. to say a few words. Over to you, sir.
Good evening and namaste to all the respected dignitaries on the dais and all the attendees on the MAHAIAP YouTube channel. As I will be sharing my presentation for quiz, that time I will say everything. But now just let us have this quiz in the form of a new learning of regarding thalassemia, sickle. And really to say while preparing the quiz, many questions are such that we are also not aware of the things. So let us hope a good learning, and most important, let gynecologists and pediatricians come together to make our state as far as possible thalassemia zero. The hard work is done by Dr. Sandeep Karle sir, Dr. Naresh Taide sir, and so many pediatricians are involved in this. Let us join together hands to make our state thalassemia zero. With that, I wish all the best to all the teams, all the team leaders, and I'm sure everybody is a winner because we are gaining the knowledge. We will gain knowledge everything about thalassemia sickle. Thank you.
I would like to welcome Dr. Upendra Kinjewadiker sir. He is President, Central IIP elect. Welcome, sir.
Yeah. Good evening, everybody. Namaskar. Thank you very much for your kind invitation. Unfortunately, I'm traveling from Davangere to Bangalore, so in car, and my video quality may not be, may not be able to see me also because it's totally dark outside. But all that said and done, it's an honor to be associated with MAHAIAP programs. Always a pleasure. Just last week we had wonderful. Last month we had a thalassemia awareness program, and this time we are going ahead with sickle. And in fact, I am more happy that you have also involved the OBGY colleagues. I think that is extremely essential, important. And the entire focus of this program is on awareness. I like the concept of quiz along with OBGY colleagues because without them, it is impossible. So I am really thankful personally to Dr. Sandeep Karle who gave me an idea. In fact, I am also talking at national level with our OBGY colleagues. How can we have a zero thalassemia country? Because India just cannot afford to have 10,000 babies every year with thalassemia major because the amount of cost, the morbidity, the issues, challenges, the chelation therapy, transfusion, everything is humongous. Our country just cannot afford it. So prevention is very, 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 very essential. And let's all work together. And one step in that direction is this awareness through the quiz. So thank you again, MAHAIAP, for this wonderful initiative. I salute all the, the leadership of MAHAIAP, especially Dr. Hemant Gangolia, Dr. Amol, Dr. Neha, Dr. Jay Bhandarkar. They're doing phenomenal job day after day, week after week, and doing something in relation to child health. It's really best for this wonderful program. Of course, best of luck to all the teams. And I'm sure, I feel personally, there is an advantage to Team Vidarbha, who have a much more practical knowledge of sickle cell as compared to anybody else. But all said and done, best of luck to all the teams. Thank you. Thank you again.
Thank you, Upendra sir. Now I would like to welcome Dr. Chetan Shah sir. He is Vice President, West Zone, Central IIP. Welcome, sir.
Thank you. President of MAHAIAP, Dr. Hemant Gangolia sir, Secretary, Dr. Amol, my dear friend, President-elect Dr. Upendra, Dr. Jay Bhandarkar, all the dignitaries of MAHAIAP. Thank you for inviting me as a guest of honor in this very prestigious event. It's a, quizzes are always a place where you learn by playing with something. And that is always remember, you always remember whatever you listen. And quiz, even in my, pedicon, I always make it a point to attend or PG quiz, UG quiz because it interests and it makes you, aware of so many things. Of course, as your target is Thalassemia Mukt Bharat, so it is always a, dream of all the pediatricians. And even, the involvement of obstetrician will help a long way because it is together with the obstetricians and hand in hand with them that we can work towards prevention of thalassemia, early means antenatal diagnosis and handling of the intrauterine cases where we can do the termination. So a lot of things can be done to remove thalassemia from our country. And as Dr. Upendra said, we have already almost 10,000 births taking place every year, which we all want to avoid. So naturally, I congratulate MAHAIAP with coming out with such a wonderful idea of holding a quiz on this topic. And naturally, a large audience will get a lot of awareness out of it. So thank you all of you for inviting me to this function. Of course, I'll have to leave. I won't be able to attend the entire quiz because I have to catch a train afterwards. So I wish all the best to the function as well as may the best team win. But if all the the participants are real winners in our battle against the thalassemia. Thank you.
Dr. Chetan sir, hope so you are for next 15 minutes are there with us.
I am here till your draw and everything is
Okay,
over.
no problem, no problem, sir. No problem, sir. Okay, thank you very much.
Thank you, sir. The concept behind this ThalSickle quiz today is Dr. Jay Bhandarkar sir, Dr. Naresh Tyate sir, and Dr. Sandeep Karle sir. I would like to call upon Jay Bhandarkar sir first. Welcome, sir.
Yeah, good evening, all dignitaries, all participants, all experts. And at the onset, I'm very thankful to my own MAHAIAP office team, always behind me. Any idea, I with pop-up and Dr. Hemant, Dr. Amol, Dr. Vinayak, and Datta, and everybody's, and all of you, they support very well to this. Why this concept, right? When I see any patient of thalassemia or sickle cell, I feel why this child is born, right? I say this child should not born at all, right? We know why should the child, there is 1 lakh thalassemia patient and 1,50,000 sickle cell anemia patient in our India, right? So why not to create the awareness between the healthcare worker, NGOs, public awareness about the prenatal diagnosis, genetic analysis, then almost 4 to 5 decades, India is trying to have a zero thalassemia or any hemoglobinopathies in our India. So let us, I thought that, and I just said to Dr. Naresh and Dr. Sandeep, why not to come with the idea of a quiz, because that when it comes to the thalassemia or any things about the hematological disorders, we get on back foot, but difficult to treat, difficult to understand the disease. So quiz is always a good idea, what I found of, and a special thanks to both of them. They've taken their own time, and this they have taken a lot of pain to create the content of the quiz. The questions are very practical ones, and you can get this excellent knowledge out of it. So let us get transfused with the knowledge and get all this I think the adnan about this by the chelation therapy of this event, I can say. And another thing, special thank to Dr. Hemant for all this PPT and that all content, that animation, which I give idea to him, and he just procure it and do it. So all the what you see in the quiz today, all whatever तुम्हाला आवाज येईल, टाळ्या येतील, काय येतील, सगळे जे कळेल ते डॉक्टर हेमंतनी मी काही गोष्टी त्यांना पुरवल्या असतील आणि त्यांनी ते केलेलं आहे. And again, I thank to Dr. Naresh and as well as Dr. Sandeep for the beautiful thing, and main thank to Amol. अमोलला एकच आयडिया दिली की अमोल मला हे टीम पाहिजे, ते नाव मला 10-11 तारखेला पूर्ण पाहिजेत. अँड थँक्स टू हिम, इज ऑलवेज ऑन द टेलिफोन मोड. सर काळजी करू नका, तुम्हाला टीम मिळेल. तर हा कॅन्सल झाला. तो I special thank to Amol for this. And our own IP office Datta, he contacted all of you for that thing and to join in a large number and properly, and as well all participants. Yes, winning and losing, yes, quiz is there, rules regulations are there. We're not bothered about that or who is going to win. I know we are going to get the excellent knowledge of by the quiz, and we are blessed with the excellent experts. 2 experts already there. Dr. Bhagesri said, is a senior pediatrician from Navi Mumbai, and she's an expert in this hematology disorders. Otherwise, Dr. Kanvinde sir is from Pune, and about that we have the Dr. Ruchira Mishra. She's the SRCC hematologist consultant. She also joined, and I'm going to take inputs from her also, and as well Dr. Sandeep and Dr. Naresh Tyate is there. So I'm very much excited to start as a quiz master. Though I will be strict in the giving the orders to you, but do not take it to heart, do not take it to your brain, rather just follow it, so that everybody, the team has, the organized team has taken a lot of pain to organize this. so that we follow that online. Yes, it can be fantastically done. Just follow that idea. When the team is called, yes, I'm going to explain on the rules and regulations, but when team is called, that team should be video and audio should be on, other should be muted, and as well as video should be off, and follow the instructions. And another thing, when you I'm just explain the question, you should not, unless until I start, your time starts now, then and then start talking, so that suppose you start talking when the question is put on the dais, and there will be other audience as well as
Dr. J, may I intervene? Dr. Ramesh Kumar has found time for us, and we will seek his blessings. Otherwise, he's boarded the plane. Dr. Ramesh Kumar, sir, welcome, sir.
Ramesh Kumar, sir, welcome, please.
Thank you so much, sir. It's a pleasure being there with you. And in fact, I'm just on board to Patna for the Palmostar module, but then it's a great pleasure joining you all. And it's a wonderful initiative. And in fact, MAHAIAP is working, I must say. There are a lot of initiatives, and this particular quiz and the modality and the models, the formats, everything seems so innovative. And we are really proud about the way MAHAIAP is going. And congratulations to Hemant Gangolia as well as Amal Pawar and the moderator Chris Master Bhandarkar. And I must please acknowledge the presence of our Vice President Charan Shaji Upendra. I'm not sure, I'm not seen, but then it's great going, and all my stalwart friends are here. So my best wishes to the quiz program as well as the
Hi, Ramesh, I'm very much there.
Upendra, I didn't see you because I just joined now.
Also traveling.
So it's a great pleasure. I understand, but then thank you so much, Upendra. But then it's a great pleasure being this is going to be our icon, leading to your status, keeping up your status as the biggest branch. You're really living up to our expectations and really setting new benchmarks for the state branches. So my congratulations again. My best wishes to all the participants, Bhandarkar ji, Jay, as well as Hemant Gangolia, as well as Amol. You are really going great. Once again, thank you so much, and my best wishes. Thank you.
Thank you very much, Dr. Ramesh, sir. He is our CIP president, beloved CIP president of Central Indian Academy of Pediatrics. Thank you, sir, for taking out valuable time from your busy schedule. Thank you very much.
Okay, so all the best of the participant. Back to Neha again for the further proceeding. Dhanyawad.
Thank you, Jay sir. Thank you, Ramesh sir, for joining. Now I would like to call upon Dr. Rajendra Singh Pardesi, sir. He is President AMOG. Welcome, sir.
Thank you so much. Good evening, everybody. Respected Dr. Ramesh Kumar, Dr. Upendra Kinjwadekar, Dr. Vinit Saxena, Dr. Chetan Shah, and Office Bearer of Maharashtra Academy of Pediatrics. First, I wish to congratulate Quiz Master, Dr. Jai Kumar Bhandarkar, and Dr. Coordinators, Dr. Hemant Gangolia, and Dr. Amol Pawar for organizing such an academic and practical quiz on thalassemia and sickle cell anemia. Thank you, Dr. Amol, for inviting me for this quiz. Amol was very behind me, sir. You have to come. As an obstetrician, you have to come. I know there are too many problems in pregnancy due to thalassemia, as it can develop anemia, chances of preterm labor, may need frequent transfusions during pregnancy, and ultimately it can affect fetal growth, as you know. Even due to sickle cell, also chances of miscarriage will be increased, preterm birth, low birth weight babies. And as these two are the indirect causes of maternal morbidity and mortality. And I think this will be the best quiz to answer all the queries regarding thalassemia and sickle cell anemia. I congratulate Dr. Sandeep Karle, Dr. Naresh Tade, Dr. Shailesh Kanwinde, Dr. Bhagyasri Seth for this quiz. I don't want in between you and this scientific content. I wish every success to this webinar and quiz. Thank you so much. Thank you,
sir. Thank you.
Thank you, sir. The backbone behind this quiz competition and the quiz construction, along with Jay sir, is Dr. Naresh Tyade sir. He's from Amravati. Welcome, sir.
Thank you. First of all, I welcome and congratulate all the participants for joining this program. This quiz is not just on sickle cell and thalassemia. This quiz is about knowing the basic of prevention in sickle cell and thalassemia, which is the need. In textbook, we learn lot of theoretical things about this disorder, but in practical, what is required is the prevention. So we try to give the message of prevention and treatment along with the basic knowledge of sickle cell and thalassemia in this. So you don't have to worry about it. It is not going to be very high question, but it's actual practical knowledge questions. And I just request every participant that they should listen the questions very carefully and also read the answer and understand them before answering it, because out of 4 there may be 2 answers which are maybe very simple, you think you can directly rule out, but 2 answers may be somewhat tricky and you have to choose among them one very wisely. I again give best of luck to all the participants, and thanks MAHAIP for organizing such a wonderful quiz. Thank you very much.
Thank you, Naresh sir. Now I call upon Dr. Sandeep Karle sir from Parvani. Welcome, sir.
Good evening, everyone. Respected Maharashtra IB President, Dr. Hemant. Hello, I am audible?
Yes, sir.
Yes, sir.
Respected Maharashtra IB President, Dr. Hemant sir, Dr. Jay Bhandarkar, Dr. Amal Pawar, respected Dr. Upendra Kinjawdekar sir, Dr. Rajendra Pardesi sir, Dr. Bhageshri Seth madam, and my respected colleagues. I first of all thank Maharashtra IIP for taking these 2 topics, thalassemia and sickle cell anemia, in priority, and we are conducting this quiz together. And this is a very good idea that pediatricians and gynecologists are coming together and participating in this quiz. As such, we all know thalassemia and sickle cell anemia are very well known old diseases. The scientific knowledge is very well known to us. And we also have a national guidelines 2016, which clearly mentions that universally we should screen every pregnancy for thalassemia, sickle cell anemia by doing HPLC test, and we have to implement this thing. But somewhere our willingness, our willpower among all the doctors, somewhere we are lacking. That's why so many babies are getting delivered to our country, and almost 20% of the blood from civil hospitals is given for thalassemia patients. So this is definitely not a good sign. So I thank Maharashtra IIP, and this is definitely a united job of pediatricians and obstetricians, and this will be definitely first step that we will be coming together, and henceforth these 2 branches will work together unitedly. And we all know, rather than treating and managing thalassemia and sickle cell anemia patients, it is better to prevent them. So I thank you everyone, and whatever questions we have framed, our purpose is to just to deliver a knowledge in a very simple way and with very simple questions. So thank you everyone, and best of luck to all the participants. Thank you all.
Thank you, Dr. Sandeep. To add what you said, because there are the guests who are present, we had midterm CME at Aivatmal on 5th of June. And that day, what we did, all delegates, we requested to give the blood for HPLC test. And so that is a small study which we have done. How many doctors were present, how many have given blood, and how many will come for it. Probably Dr. Sachin Patil is one of the contestant here. He may update with that, and we are waiting for the report of that. So in the screening, how much do we find? But I have to stress a point. Yes, we did have the reluctance on the part of the doctor in giving the samples, but that is a part and parcel. Let's go ahead with the quiz. Yes, Dr. Neha.
Yes, sir. The experts for today quiz is Dr. Bhageshri ma'am from Navi Mumbai. Welcome, ma'am. Dr. Bhageshri ma'am.
Yeah, thank you.
Yes, ma'am.
Thank you.
Yes.
Ma'am, would you like to say something?
Yeah, I congratulate all the MAHAIP members and the organizers of this quiz for taking the initiative to have a quiz on thalassemia and sickle cell anemia. Thalassemia, as we all know, we celebrated in the month of May, Thalassemia Day, and Sickle Cell Day we'll be celebrating tomorrow. So it's a very good initiative, and of course, quizzing is a very good activity and sharpens our brains. So all the best to all the teams, and may the best team win. Thank you.
Thank you, ma'am. Yeah. Now I would welcome our second expert, Dr. Salesh Kalvende sir from Pune. Welcome, sir.
Hello, am I audible?
Yes, sir.
Yeah, okay. Hi. At the outset, let me thank MAHAIP for this opportunity and congratulate it on having such a innovative activity regarding thalassemia and sickle. So best of luck to all the participants. And yeah, I mean, any whatever inputs we can give for the meeting, I'll be glad to assist. Thank you very much.
Dr. Neha, please invite Dr. Ruchira Mishra, hemato-oncologist from SRCC Mumbai. Madam,
Yes, ma'am.
your blessing, please.
Welcome, ma'am.
Thank you so much, sir, for inviting me. I think this is such a novel and exciting opportunity. There is a great need to eradicate thalassemia, and I think prevention is the way to go ahead with it. We can always treat thalassemia, but if we can prevent it, then that's the only way we will reach our goal of thalassemia zero. I hope all the contestants are ready to gain some learning out of it, and it will not just be the contestants, even we will gain something out of it. So thank you once again for inviting me. I'll be listening in very attentively to all of this. Thank you.
Thank you, Ruchira, ma'am. Now I would like to hand over the mic to Dr. Hemant Gangulia, sir.
So let us start this MAHAIP ThalSickle quiz. Today is 18th June and tomorrow on eve of World Sickle Day, 19th June. Welcome all to MAHAIP ThalSickle quiz. Our quiz master is Dr. Jay Bhandarkar, Dr. Naresh Thaide, Dr. Sandeep Karle, and quiz coordinator being myself as well as Dr. Amol Pawar. And thanks Dr. Amol to get all the teams throughout the Maharashtra. It was a tough job to do it, but he gathered all the 3 pediatricians and 2 gynec for one team all across the Maharashtra. Though we have 5 zones, but he created one extra team from our Maharashtra. So we have 6 teams to play. Our experts, I will acknowledge the presence already. They have given their words. Dr. Sailesh Kanvide from Pune and Dr. Bhageshri Seth from Navi Mumbai. And also we are fortunate to have Dr. Ruchira, another expert. And we will look forward if there is ambiguity in the question, in the answering, or any expert comments, we will be looking towards to you experts. So please feel free to say if anything is there. Of course, this quiz is not a single man work. It's a teamwork, and we really appreciate the support team which we are required. And whatever the PPT you are seeing, whatever the backgrounds are there, whatever this Ganesh Vandana is there, what is the lighting the lamp, that is contributed by Dr. Sunita Ingle, madam. Dr. Neha Singh always as active as giving all the flyers, all the WhatsApp messages, all the circulation of those messages. Very important role played by Dr. Neha Singh. Dr. Vishal Raut is a techno wizard of our MAHAIP, and is all the when in the last year when the corona struck down and we were just not coming out of it, on the 1st of July, Doctor's Day, we just came out with this concept, and then we started all the technical things, and lot of contribution given by Dr. Vishal Raut is a technical wizard. And also Dr. Abasai Patankar, he's a person from Raigad who he will be the vigilant inspector for this quiz. So anybody you are answering, while answering, you have to look into the web camera, as well as you have to answer the quiz master. And if you are doing anything, other things, probably Abasai will be picking up the things and will be helping out us. So he's a vigilance inspector for this episode. As already said by Dr. Amol Pawar, our first team is Team Mumbai Konkan, which is led by team leader Dr. Amit Jain. And I will request Dr. Amit Jain, please give one line introduction of yourself, and we'll ask your team members to introduce themselves. One line is your name and as the place where are you doing and what your specialty. Please, Dr. Amit Jain, go ahead.
Good evening, everyone. Myself, Dr. Amit Jain. I'm working as a junior consultant in pediatric hemato-oncology in MCGM, CTC, PH and DMT Center, Borivali.
Please introduce your team members.
So our team members are Dr. Amit Saxena, he is a pediatrician, Dr. Sunil Seth, and gynecologist friends are Dr. Rajan Chavan and Dr. Shailendra Jadhav.
Welcome Mumbai team Konkan. The second team is Team North Maharashtra. I will request Dr. Rahul Patil, the team leader, to introduce himself as well as his team members. Please, Dr. Rahul.
Good evening, everybody. I'm a pediatrician with some intensive care experience. Currently, I just shifted from Panvel to Jalgaon in the last year only. And recently, I am running my small clinic with one ICU setup. And my team members are the gynecologist from gynecology side, Dr. Chandrakant Sankleja sir and Dr. Mugdha Bhamre madam. And pediatrician, myself, along with Dr. Yogesh Salawate sir from Dhule and Ganesh Mani sir from Nagar.
Thank you, Dr. Rahul. The other team is Team West Maharashtra 1, because we have two teams from West Maharashtra. So this is MH1 or the team West Maharashtra 1. Dr. Shailesh Patil is the team leader. I will request him, please introduce yourself and your team members. Shailesh sir.
Yes, I am Dr. Shailesh Patil. I am practicing at Karad, General Pediatrics and Neonatology. Our team, we have gynecs, Dr. Kishore Kesarkar from Kolhapur and Dr. Nisha Gusen ma'am from Sangli. And pediatrician, apart from me, Dr. Amruta Shivchand from Kolhapur. And Dr. Lakshman Kadam sir is not present today, maybe because of some emergency. So we two gynecs are present. Thank you.
Thank you, Dr. Shailesh. So you are having one team member less, but all the best. Yes. You will do the best.
Thank you.
The another team is West Maharashtra 2, and I will request team leader Dr. Parag. Please introduce yourself as well as team member. Yes, Dr. Parag.
Good evening. Myself, Dr. Parag Mahankar. I am a lecturer at Bharti Hospital, Pune. I am working as a pediatrician and pediatric hemato-oncologist. My team members from the gynec team, there is Dr. Sumit Chamaria and Dr. Kanjar Durukar, and from pediatrician Dr. Saurabh Mutha from Baramati and Dr. Sudhir Asbe from Pandarpur.
Thank you very much, Dr. Parag. Next team is Team Marathwada, and the team leader is Dr. Shilpa Madam. So I will request her to introduce herself as well as her team members. Yes, Dr. Shilpa Madam, are you there? If she's not there, anyone from the team, please go ahead.
I am myself Dr. Prarthana Shah. I am practicing fetal medicine gynecologist at Aurangabad. Dr. Shilpa Madam is from Ambezogai. Dr. Ahil Sakre sir is from Nanded. Dr. Sachin Jetlia is a pediatrician sir, and Dr. Nandakishore Palwai is also pediatrician from Jalna.
All the best, madam. Our next team is Team Vidarbha, and team leader is Dr. Seema Madam. So I will request her to introduce herself as well as team members, please.
Hello, I am Dr. Seema Dande from Nagpur, Maharashtra. I am a consultant at Dande Group of Hospitals, Ravinagar, Nagpur. I have Dr. Suyoga Panath from Amravati as a gynecologist and 3 pediatricians, Dr. Sachin Patil from Yavatmal, Dr. Satish Ghatol from Akola, and Dr. Sagar Karotkar from Wardha. But I think 3 of us are there till now.
You can please call them and please ask them to join, please, madam.
Okay.
So all the best, all 6 teams to this wonderful quiz. And the most important thing is their naming ceremony. Dr. Jay, I cannot see the who are the present because I'm sharing the screen just to make the point. Whatever I say, they are there or not, just make a point. And I will just request Dr. Sunita Madam also to please note the names of the against the teams. So actually, we have 6 teams. And while preparing quiz, we have made 6 question sets as per the names what we are going to give now. So to keep the transparency, and we are not biased to against any for any team. So what we will doing, all these 6 teams, what we have seen, Mumbai, Konkan, North Maharashtra, West Maharashtra, MH1, West Maharashtra, MH2, Vidarbha and Marathwada, all will be named. आणि त्याच्या आपण मराठीत बोलतो, आपण त्याला बारसा करणार आहोत. आणि बारसा करताना आपले जे पाहुणे आहेत, Dr. Chetan Shah, Vice President West Zone, he will be doing that ceremony, honor for that. And for that, we will start this naming ceremony. So I will request Dr. Chetan Shah, please, if he's there, put his video on. And he may be, I will request him to show the bowl which is having all the cheats, 6 cheats of the teams. So as I will be telling the name, and he will be picking up the cheat. So that name goes to that team. So our first name is Vernon Ingram. So this is a German-American biological professor who studies sickle cell anemia. So this team will be named as Vernon. And for Vernon, I will request our Vice President, Dr. Chetan sir, to just pick up one team from the ball and just tell which is this team.
Thank you, Hemant bhai. It is North Maharashtra.
So North Maharashtra is their new name is Vernon. Okay.
Okay.
Thank you, sir. Please, all the teams, please note that North Maharashtra will be called henceforward as a Vernon. Our second is Dr. Fritz Fuchs was an internationally known obstetrician gynecologist who has introduced amniocentesis. So our next team will be named as Fritz. So I will request Dr. Chetan sir to pick up the next team for this thing, for the new name.
It is West Maharashtra 1.
So West Maharashtra 1 is Fritz. So please remember, because we will be calling by not the team, that old name, but the new name. The third name we are given Gregor Mendel, and everybody knows he is the father of the genetics. So our third team will be named as Mendel. So I will request Chetan sir to do the honor.
So it is West Maharashtra 2.
So West Maharashtra team is Mendel.
West Maharashtra 2.
West Maharashtra 2 is Mendel. West Maharashtra 1 is Fritz. Okay. I hope Dr. Sunita madam is noting all the things, as well as Dr. Jay is noting the things. Our fourth name is Dr. Robert Guthrie, who is the father of the newborn screening. So let us have the fourth team with this new name.
That is Vidarbha.
So Vidarbha will be Robert. So this team will be called as Robert. These are all the scientists. So we have kept this related to the thalassemia and sickle. Our fifth name is James Herrick. He is credited with the description of the sickle cell disease. He is an American physician. And so we will have the fifth team to have this name, James.
It is Marathwada.
So Marathwada is James. And of course, the last, whatever is remaining, to complete the formality, he will pick that and will announce. But then the sixth name we are given, Linus Pauling, and it is in the blood, a history of Linus regarding hemoglobin and sickle cell anemia. So I will request the last team which is left, and I think so it is, yes, sir.
Mumbai and Konkan.
So Mumbai Konkan is Linus. So we have 6 teams renamed here, and we will be going ahead with the question sets with first will be Vernon, second will be Fritz, third will be Mendel, fourth will be Robert, fifth will be James, and last will be Linus. I will request Dr. Chetan sir to declare the teams if he has noted down. Otherwise, I will just say and he will just announce and the team. So Vernon team is North Maharashtra. Yes. So Vernon, North Maharashtra team leader, please acknowledge.
Yes, sir. Yes, sir.
Please tell your name.
Vernon.
Yes. So North Maharashtra team leader Dr. Rahul Patil is Vernon. The next team is Fritz. So Fritz is West Chetan sir.
Maharashtra 1.
West Maharashtra 1. Team leader, please acknowledge.
Yes, sir.
Name, please. Your name, please.
Fritz. Dr. Shailesh Patil. Fritz.
Dr. Shailesh Patil. Yes. Okay. Then our third team is Mendel. So Mendel, Chetan sir.
West Maharashtra.
West Maharashtra 2. So please, team leader West Maharashtra, acknowledge.
Yes, sir. I'm Dr. Parag from West Maharashtra 2. Our team is Mendel.
Okay.
Gregor Mendel.
So all team members, please note all the things. And the fifth team is of James. Chetan sir.
That is Robert Guthrie.
Robert. Sorry. Forgot.
North Maharashtra.
Robert is
Vidarbha.
Vidarbha. Robert is Vidarbha, sir.
Yes, sorry.
Vidarbha.
Yes, Vidarbha.
Vidarbha team leader, please acknowledge.
Dr. Seema Dande, Vidarbha. The name is Robert.
Yes. Thank you very much. And the fifth team is James.
That is
please. That is
Marathwada.
Yes.
Marathwada team is James Herrick.
Dr. Shilpa Dadge. Our
Yes.
team name is James.
Okay. And last team, Linus is the
Mumbai and Konkan.
So please, team leader of
Yes,
Mumbai
sir.
Konkan, acknowledge.
Yes, sir. Our team name is Linus.
Okay.
I'm Dr. Amit.
So with this, we finish this naming ceremony. I hope so all teams know their new names. Any one word or two sentences from Dr. Chetan sir, and we will move ahead. Dr. Chetan sir, please.
Really, I see the enthusiasm and the organization behind this. Lot of efforts to make it a real, a high quality quiz, and so much enthusiasm amongst the members, the players or the teams also. And I really thank all of you. Wish all of you all the best. May the best team win. But I think at the end of the day, all the players are real winners, and you will give the excellent message to the listeners. And I thank all of you to give this honor of this naming the teams as well as inviting me as a guest of honor here. Thank you so much, everyone. And thank you, Hemant Bhai. Thank you, Amol. Thank you, Jay. And all of you, all the dignitaries. Thank you so much. And have a best and excellent quiz ahead. Thank you so much.
Thank you, Dr. Chetan sir, our beloved Vice President, for doing this honor of naming the ceremony. Thank you very much, sir, for taking out the time from our busy schedule. Thank you very much. So with this, we end with the this naming ceremony, and already we have discussed with rules and regulations with all the quiz participants during the test run. But in a short, I will request Dr. Jay sir to go quickly through these all slides. Yes, Dr. Jay, please.
Yeah. Thank you, Hemant sir, and thank you all the best all of us. So there will be some rules and regulations for this. There will be 3 rounds. Round 1, round 2, and round 3 is the rapid fire, and if required, tiebreak round. That is the 4th round. So round 1 will be there will be multiple choice questions. So you have to choose one option of that. 10 points for the correct answer, and 0 point or no for the wrong answer. Time duration is 15 seconds. Please remember, when team is called, you should join it. Others should be muted and video off. And when I read full questions, give all the option. Then and then, when I say your time starts now, then you start talking. That is first thing. And I can you can choose anyone out of you other than team leader also who can answer the question. Or your question start before the time clock stops. And round 2 will be also same, multiple choice questions, and each team one by one, the name I will call, and I will take round 1 4 question at a stage. Round 2 there will be at a stage, and as well as by rapid fire, each team will call, and within maximum 60 seconds or maximum 10 questions I will ask to you, and each correct answer will be 5 points. And rapid fire also, I suggest you name one person so that I can consider on that person to take your answer from that, and answer should be very specific. Appropriate unit should be mentioned as per the requisite, and each round will consider above stated number of questions to each team at a stage, and that team only will be on the dice, other will be muted and video off. There is no passing on question from one team to another. If question goes unanswered by the question team, no prompting. Even I will go to the expert by addressing them. Please, give your input to this, right? And we see that as we are doctors, where a lot of viewership is there. So any ambiguity, any queries, you can definitely call later to our experts, and you can get clarified it. And answer given to the quiz master within stipulated time will be only registered, and only one answer is allowed to. You cannot change the answer once you have answered it. So that is then a winner will be decided by adding all the 3 scores 1, 2, 3. That is round 1, round 2, and the rapid fire. In case of total points or there is tie up, so the extra questions are asked, determine the winner by one order of the team. So all the best for this, and a lot of things that are already written. The participant, yes, they cannot join from the same screen, and see that you look at the web camera and no looking sideways. For party you are watching, or vigilant team is like IPL. And in case of there is suspicion that the cancel the question will cancel, and if possible we'll ask the next question or debar that question, and see that your internet ability, connection, auditability, visibility is your responsibility. And quiz master decision is final. I can say the organized team decision is final because we have studied and a lot of references taken to define all the quiz questions and answers. And if there is some problem, we go to the referee because we are 4 or 5 experts are there. So all the best. And I think Hemanji, can we start the quiz now? Because
Yes, thank you, Dr. Jay. We will start the quiz immediately. So, but because I'm sharing the screen, I cannot see everybody. So please, Dr. Jay, Dr. Neha, as well as Dr. Sunita, plus see to that all the participants, as well as Dr. Abbas Sahib, if he has joined. If he has not joined, please, I will request Dr. Sunita to call Dr. Abbas Sahib to join through Zoom link. So let us go for the round one.
Round one.
Yeah, I'm there, sir. I'm there.
Okay.
Yes. Dr.
So
welcome,
team
Dr.
Vernon, the North Maharashtra, please acknowledge your presence, and others, please keep your video and audio off. Thank you.
Yes, sir.
Hello, sir. Yeah. Team there, please acknowledge. Team leader, who is the team leader?
Rahul is there, sir.
Rahul. So I
Yes,
will concentrate on you. You can discuss this question, and please see that. So here we come. Our question bank master, I can say, Dr. Hemant, please put first question of this beautiful. So this is a question for you, Team Vernon. Thalassemia is what type of disorder? Options are A, inflammatory disorder, single gene disorder, C, chromosomal disorder, and option D is none of above. Your time starts now.
So my answer is B. It's a single gene disorder.
Okay. Yeah. The team leader has directly answered the single gene. Let us see our answer bank also says, confirms that answer. You are perfectly right. So congratulations, bingo. You have started with bank. You scored 10 marks and thalassemia is a single gene disorder with autosomal recessive mode of inheritance, and hemoglobinopathies are the most common genetic disorders found worldwide. So congratulations, Rahul, for this good start of the quiz. So you are moving on for the second question for you on the screen. A 9-month-old child with anemia and mild icterus. CBC showed normo and macrocytic anemia with sphenomegaly. All may be diagnostic possibilities, except your options are A, beta thalassemia major, B, vitamin B12 deficiency anemia, C, hereditary spherocytosis, and D option, sickle cell anemia. Just understand the question first, and your time starts now.
Macrocytic. So
it's a normocytic, normo and macrocytic with splenomegaly. So beta major possible, sickle possible, spherocytosis. Sir,
Yes.
my answer is
vitamin
A, beta major.
Okay, let us confirm your answer. Hemant sir. Yeah, you are perfectly right. So beta thalassemia is the answer. Our experts are there. Dr. Taide sir. Taide sir, are you there?
Yes, sir.
Hi, sir. Please explain. He barobar ahe ka?
Yes, sir. We have to always remember that most of the thalassemia are microcytic anemia.
Microcytic hypochondria.
Yeah, right.
So please understand this. All thalassemia are the microcytic anemia. And our questions is like a PG NEET questions. Thank you, Taide sir, for addressing this. So see, when there is microcytic anemia, one of the differential diagnoses of thalassemia possible. You have to look it after. Thank you. So your congratulations, the team Vernon. You are moving on with the third question for you. Menzel index is the MCV divided by RBC count. It's a screening tool for thalassemia trait in hemogram. It may be false, positive, or negative sometime. Below what level it suggests thalassemia trait? Your options: A15, B12, then C13, and D14. Your time starts now.
Sir, my answer is straight away option C. Below 13 is considered to be a suggestive of thalassemia trait.
Okay, your team leader Vernon Rahul has taken C, na? 13. Let us confirm answer with our team. You are perfectly right. So, Carle sir, are you there? Congratulations, team Vernon, Marathwada, North. Carle sir?
Yes, sir, I am there, sir.
Please explain this. What is the mental injuries? आपण जे केलेला question frame केलाय तो correct आहे का?
Sir, the question is correct. This is a index we can calculate from our CBC, and our aim is that everyone who is looking at the CBC should look for the MCD as well as RBC count. Nowadays, the softwares are available and the things are easily available, but still we have to look at the RBC count. In most of the anemias in pregnancy or in other conditions, RBC count is low, but thalassemia straight is the condition where RBC count is high, and it is really a reliable thing. So we should look at the RBC count and Mendes index.
Okay, thank you, Carle sir. We are moving on to the fourth question for the team Vernon. What is the screening test for beta thalassemia? Your options are Nestrov test, solubility test, C option bone marrow aspiration, D hemoglobin. Your time starts now.
So the answer is Nestrov test, option A.
Okay. So that opening batsman and opening team is so confident, they are not even getting 5 seconds to answer the questions. So let us confirm. Yes, you're bingo. You're quite correct. So Albert scores at 10 marks. Bhageshri madam, तुम्ही आहात का? Bhageshri madam, our expert. Are you there, madam? Okay. Doctor.
I'll just unmute myself.
Yeah. Any one of the expert can comment on this.
The answer is correct according to the options which are given. So screening test for beta thalassemia trait could be a Nestrov test, especially in the antenatal mothers. There have been studies done on Nestrov, which is a naked eye single tube red cell osmotic fragility test. Or the other option, if it was given over here, could have been okay, I'll not tell the answer. Maybe it's there in some other questions.
Okay.
It's the correct answer.
Any other expert comment from experts on these 4 questions? Just a minute.
Anvinde sir, तुम्ही आहात?
Yeah. However, nowadays not many people are doing this test because we do have better options. Basically, the microcytosis, which is resistant to hemolysis, and that is what is used in this test.
Okay. So thank you, sir. So team, they are scorer. Sunita madam, final score क्या है team Vernon सा?
Team Vernon has cracked all the questions and their final score is 40 in round 1.
Okay.
Well done.
Thank you, Sunita madam. So moving ahead with the now the next team should be joined as a West Zone Maharashtra MH1, and please acknowledge yourself presence of the team members. MH1.
I'm Dr. Shailesh Patil, leader. Our team is Feds.
Okay.
And other members.
All members are joined?
Yes. We joined.
Okay, all members, please say hi.
Yes.
Hello.
Hello, sir.
All the best. And thanks for participating in this beautiful quiz, and enjoy that. I can say the somewhat excitement and the knowledge. So, are you ready, sir?
Yes.
Are you ready, all of you? MH1.
Yes.
Okay.
Yes, sir.
Yes. Team Reads, here's the first question for you on the screen. When we receive HPLC report of adult, what is the cutoff to diagnose beta thalassemia trait? Your options are HbA2 level above 4%, HbA2 level below 1.5%, HbA2 level between 1.2 to 3.4%, and HbA2 level above 3%. Your time starts now.
Amrita madam 4% na?
4% जास्त.
Above 4%.
Yeah. Yes.
Yes.
My answer is option A, HbA2 level above 4%.
So team leader Dr. Shailesh Patil opted for the option HbA2 above level 4%. Let us see. Hemant sir, please. Yes, congratulations. And it's a perfect answer for you. Your question, you have scored 10 marks. Yes, Shinde sir, Karvinde sir, please explain this to our all audience and participant. Your Bhagisri madam.
Yeah, see, the importance is as mentioned here, is the borderline levels, which can vary from different labs, 3.4 to 3.6. We have to be very careful in that situation, and further evaluation is necessary. But those above 4% are clearly abnormal, and that should be taken as a thalassemia trait. But if it's more than, say, 7 or 8%, then I think it indicates a different process. So generally, the level is between 4 to 7% in thal trait.
Okay, thank you, Karvinde sir. So congratulations, team Fits. So moving on to the second question, please on the screen. The thalassemia is a hemolytic disease. Where does hemolysis occur in thalassemia mainly? Option A, liver, spleen, bone marrow, none of above. Your time starts now.
Amrita madam.
Spleen, I guess.
Spleen.
Yes. My answer is B, spleen.
Okay, so team leader has opted for answer spleen. Okay, let us confirm answer with our organizing team. Human sir. So actually the answer is bone marrow. Carle sir, please explain this.
Yes, sir. In thalassemia, sir, usually it is ineffective erythropoiesis. So that's why the major hemolysis usually initially occurs in bone marrow. But as the disease progresses, then further hemolysis also occurs in spleen and liver. But the major site is our bone marrow.
Sir, then why there is hepatosplenomegaly in thalassemia?
Bhagesri madam.
Yeah, so rightly the answer is bone marrow, as rightly said that there's an excess of alpha chains which precipitate in the red cell, and that causes destruction of the cells in the marrow itself before they are thrown out into the circulation. I can answer the hepatosplenomegaly part provided the question is not there for further this thing.
Okay, madam. Yes. Okay.
Because I
I
might
will take
give away
inputs
the
later.
answer, so don't ask too many questions unrelated to this question.
Dr. Jay, I will request Madam Dr. Bhagesri to please keep this with a note with you. In the end, we can
Sure.
Okay.
Yes.
Sure.
Okay.
Yes. Yes.
So there will be quiz questions for the experts then later. Okay.
I
But
could
moving on to the
answer
third
it
question.
now, but you may give
No,
away
no.
the answer
Yes.
to the next
Yes.
question.
Okay.
Yes.
So team Fritz, are you ready for the third question? A pregnant lady came with microcytic hypochromic anemia. Her HbA1c report as a normal with HbA2 3.2%. Her husband is a thalassemia trait. What you will do? Your options are: no risk of disease to baby as mother is normal, no further testing, do chorionic villus sampling, to do mother's HB beta gene sequencing for the diagnosis of beta thalassemia trait or oblique silent carrier. I will read for you again somewhat difficult questions. A pregnant lady came with microcytic hyperchromic anemia. HbA1c reports with normal HbA2 3.2%. Husband is thalassemia trait. What will options are? What will do? No risk to the baby as mother is normal. No further testing. No chorionic biopsy. To do mother's HB beta sequencing for diagnosis of beta thalassemia trait oblique silent carrier. Your time starts now.
I think my answer is D. Do mother's HB beta gene sequencing for diagnosis of beta thalassemia trait or silent.
Okay, let us confirm your answer with our software, what we are designed. Yes, so you are perfectly right. So Bhagesri madam,
Yes.
whether this is correct?
Yeah. The answer, yeah.
Right.
The answer is correct, but the question probably should have been also giving us what is the gestational age or gestation in weeks, because that will decide about which sampling you will do, etc. Here it is basically because in pregnancy with iron deficiency anemia, you can have a falsely low HbA2. So since the husband has been diagnosed with a THAL trait, we cannot take a chance and assume that this HbA2 is normal, and therefore it would be wise to go ahead with either a genetic study for checking THAL trait in the mother also. And of course, there are certain silent carriers or certain mutations which are not picked up with a high HbA2. And for picking up these mutations also, since the husband has a THAL trait, there is a possibility in pregnancy with a low HbA2 also that the mother could be a THAL trait. So practically, this is the correct answer.
Okay, thank you. Dhanyavad. So team, the first question. थोड़ा आमच्या हेमंत सरला घाई झाली. He is not just asking the quiz, not waiting for the quiz master to pose the question. Yes, first question for the team. Following findings may be present in all except. Please read. Following finding may present in all except. Right.
What is the finding? What is the finding?
The finding. It is.
Splenomegaly.
Splenomegaly.
First is sickle cell disease. Second option, hereditary spherocytosis, portal hypertension. Third, last, there is a well transfused beta thalassemia, major or intermediate, whatever. Your time starts now.
D, sir.
Answer is B, hereditary spherocytosis.
Hereditary spherocytosis.
Are you sure, Racha? Your answer is except Matela hai.
Sir, D, well transferred beta thalassemia.
Yes, sir. D, sir. Spherocytosis will lead to hemolysis, na?
And answer is D. D.
Actually, your answer came after our time clock stops, right? I will just go to our Hemant sir. Sir, काय करायचंय आपण?
And Dr. J, request for all the teams, whatever the first answer came, we will take that answer. And if the change, we will not accept the change. So please see to that and answer specifically.
So I heard the first answer from the team leader, Dr. Shailesh sir, hereditary spherocytosis, right, sir?
Yes.
Yes, and later on you correct it with other members. So unfortunately, your first answer is wrong. So I cannot give the mark for you. Sorry for that. You corrected later. It's okay. Sunita madam, please see that in the not score this time. So thank you for attempting this question. And what is the score?
Yeah.
Sunita madam.
Fritz has managed to get 2 answers right, and the score is 20.
So congratulations, team Fritz, Western Maharashtra. And
Dr. J, a practical tip to the teams: please consult with your members and then answer final answer.
Yes.
And well transfused will be explained later on by Dr. Naresh or Dr. Sandeep, because it will has another answers and question that Indian sickle cell disease patient may not have autosplenectomy by age of 5 years. So we'll move ahead.
Okay. So thank you. So the next team is team Mendel, West Maharashtra MH2. Please join on the dais with your video and audio on. Acknowledge team.
Yes, good evening, doctor. I'm Dr. Parag. I'm a team leader for the Maharashtra MH2 Mendel's team.
Okay.
Our team members also there.
Okay.
Dr. Kanchan, Dr. Saurav, and Dr. Sumit.
Okay.
Please wave your hands.
Hi, sir.
Please wave your hands. Yes.
Nice. Thank you. Thanks for joining this quiz and participating. All the best. I will concentrate and there is a question on the screen for you. Interpret the CBC of 1-year-old female child. All may be the diagnostic possibilities except the erythrocyte count, CBC 4.99, hemoglobin 14.7%, PCV 45, MCV 90, MCSC 29.5, and red RDW is a 14.4. So options are whether it is a normal, it is a beta thalassemia trait, sickle cell trait, or D option, silent carrier of beta thalassemia. So read the question, interpret the CBC. What are the other possibilities are there? Which is not the possibility. कुठलं बरोबर नाही आहे तर हे 4 ऑप्शन्स आहेत. See again, I will read for you. RBC count 4.99, hemoglobin 14.7, hematocrit 45, MCV is 90. RDW is 14.4. With a concentrate on the RBC count and MCV. So your time starts now.
सर सौरभ सर काय वाटतंय?
सर
तर नॉर्मल आहे, आरबीडब्ल्यू पण नॉर्मल आहे.
ए वाटतंय सर आन्सर, बाकी तीन
हा
सर ए बोलून टाका सर.
Our answer is A.
Okay, let us confirm the answer. Hemant sir.
चुक है.
So relevance of MCV and RBC count.
सर मी तेच म्हणत होतो, आरबीसी काउंट कमी पाहिजे होतं थॅलेसेमियाट्रिकला.
Yeah. So our expert will explain. Kanvinde sir, तुम्ही आहात?
Sir, with the hemoglobin.
Okay. Madam, Bagesi madam, please explain.
Yeah, the only issue here is that beta thal traits usually will not have a hemoglobin of 14.7 gram%.
And for a hemoglobin of 14.7, I think RBC count 4.99 is normal.
And MCV of 90
also goes against the
too high for a beta thalassemia trait.
Usually a thal trait will have a slightly lower, I don't know, for a 1-year-old 14.7 in a thal trait doesn't quite fit in. So
basically for a 1-year-old 14.7 is very high.
High, that's
very
what.
High.
So
Till 6 months it is okay.
Dr. Naresh sir. Dr. Naresh sir.
6 months also it will fall, sir.
Yeah, this
Naresh.
question use the possibility except. So we are not dealing with the beta thalassemia trait in this patient. Because MCV is not
except, yeah.
Except,
Then it's
except.
fine, yeah. I didn't read the except. I thought it was okay.
Okay, thank you. We are moving ahead to the second question.
Only one thing, please pay attention to the except word by the word which is highlighted in red. Okay. So, okay.
Oh, they got this right.
What is the target to maintain pre-transfusion hemoglobin level in beta thalassemia major patients? Your options are A, about 10 gram percent, between 6 to 7 gram%, between 9 to 10 gram%, between 8 to 9 gram%.
Our answer is C, between 9 to 10.
Time starts now.
Answer is C, between 9 to 10 gram per DL.
I think it should be.
Team leader answered C, 9 to 10 gram%.
Yes, yes, sir.
Okay. Let us confirm the answer with our software. Yes, you are perfectly correct. Your answer is C, 9 to 10 gram%. So all congratulations, you have scored this time. Yes, so moving over to the third question for the team Mendel. How can we diagnose silent carrier in the thalassemia? Your option is A, CBC the peripheral smear, B, bone marrow aspiration, HPLC test, or mutation analysis. Your time starts now.
Saurabh sir, D घ्यायचं का? Mutation analysis.
D असायला पाहिजे सर.
D करूया सर, mutation.
Yes, our answer is D, mutation analysis.
Okay, I have confirmed answer because team leaders confirm the D mutation analysis. Let us confirm with the software. You are perfectly right.
Yes, sir.
Carles sir, please explain.
Sir, silent carriers are this is an entity where genetic mutations are there, but depending on the severity of the mutations, these are the milder mutations. So they are not expressed clinically. So these are asymptomatic people, and even CBC, HPLC or other tests do not show any clues or anything. Everything is normal. So this is very essential or very important to diagnose the silent carriers. Whenever one partner is a trait and other partners, most of the reports show normal, that time this test is very important, sir.
Thank you. We are moving with the fourth question then for the team Mendel on the dais. In normal adults, what is the hemoglobin A2 HbA2 level? Options are 0 to 1.5%, 1.5 to 3.4%, 4 to 6% or above 6%. Your time starts now.
I think B घ्यायला हवा ना
Answer
सौरभ sir,
B.
1.5
Yes,
to
sir.
3.
B, sir.
Yeah.
Yes, sir.
No, sir.
So our
Yes, sir.
answer
B,
is
B,
B, 1.5 to 3.4%.
I log the answer 1.5 to 3.4%. Let us confirm with our computer wizard. काय ते बघूयात. You are perfectly right. So this level is 1.5 to 3.4%. So normal adult has a HbA2 level 95 to 97%, HbA2 level between the 1.5 to 3.4%, and fetal hemoglobin 0 to 2%. So thank you, Team Mendel, for attempting this round one. Scorer, what is the score?
Yes, the Mendel
30.
team has scored 30. They got 3 right. Score is 30.
Congratulations. So next team is Team Robert. Thank you. Vidarbha team, please join on the dais with video and audio on. And acknowledge yourself, team leader also.
Dr. Seema Dande.
Okay. मॅडम थोडा व्हिडिओ ऍडजस्ट करा, तुमचा चेहरा पूर्ण दिसत नाहीये. थँक्यू. तुमचे टीम मेंबर्स डॉक्टर सतीश,
Dr. Sagar आणि Dr. Suyoga.
ओके ओके. डॉक्टर सुयोग,
I am driving, sir.
हरकत नाही मॅडम, काय प्रॉब्लेम नाही. ओके, प्लीज अटेंटिव्ह फॉर 5 minutes. डॉक्टर सीमा, आर यू रेडी? टीम रॉबर्ट.
Yes, sir. We are ready.
So all the best. A 6-year female child presented with severe pallor, 3 gram% and collapse-like state. It was probable present. Platelet was low, leukocyte count 25,000 in CBC. What is the most likely diagnosis in this condition? Options are non-transfusion dependent beta thalassemia, sickle cell anemia, aplastic anemia, G6PD deficiency. So this 6-year-old child present with a severe pallor and collapse-like state, and spleen was palpable, icterus was present, thrombocytopenia ahe. So what is the most likely diagnosis? 4 options are there: non-transfusion dependent beta thalassemia, sickle cell, aplastic, and G6PD. Your time starts now.
Sickle cell वाटत आहे मॅडम.
And B, ma'am. Sickle cell anemia.
B, sickle cell.
Okay. Our answer is B, sickle cell anemia.
So team leader Dr. Seema madam has confirmed the answer, sickle cell anemia. Let us confirm with our question bank answer. You're perfectly right. So this is a hemolytic crisis picture, and congratulations, bingo, you are scored this time. Sir, moving ahead with that, I will go somewhat fast because time is quite less. Interpret the CBC of 4-year-old female child. I will read for you. RBC count 5.5, hemoglobin 7 gram%, hematocrit 23.7, MCV 46.9, and MCS is 29.5, and RDW width is 30.5. Concentrate on the RBC count and the red blood cell width and as well as the MCV. Your option. So interpret what is the diagnosis for this CBC. काही ऑप्शन्स आहेत का? गंगुले सर का डायरेक्ट क्वेश्चन आहे हा? Okay, so are the options are A, iron deficiency anemia with beta thalassemia trait. Only beta thalassemia trait. C, silent carrier of beta thalassemia. D, chronic renal failure. Your time starts now.
Do you think it is A?
Ma'am, A what then?
A, no?
A, ma'am, A.
A.
Okay. Our answer, huh?
Yeah, ma'am.
Okay,
A,
our
ma'am.
answer is A.
Okay, I will log the answer by the given team leader. Let us confirm with our question bank, answer bank. Yes, you are perfectly right. So, Bhagisri madam, काही explanation देता येईल का या पेशंट बद्दल आपल्या? आयर्न डिफिशियन्सी पण आहे आणि बेटा थॅलेसिमिया ट्रेट आहे, तर डायग्नोस कसं करायचं? काही चेंजेस होतात का सीबीसी मध्ये?
I think the only confirmatory diagnosis here would be doing a serum iron studies. Just based on CBC, actually, we can't means we cannot say what it could be. But of these options, this could be the correct option. You'll also have to look at the dietary history, examine the child, and possibly also do a serum iron studies to confirm the diagnosis.
Okay.
Dr. Naresh, sir, to add something?
Yes, it is the option among this A answer is right, because all these cases other than this beta thalassemia trait and silent carrier should not have this much anemia. Hemoglobin should not be 7.
Okay.
And chronic renal failure, generally we can say that it is the normocytic anemia.
Okay, thank you, sir. So moving ahead with the question 3 for the team Robert. Prenatal diagnosis of thalassemia is a must if both parents are thalassemia trait or first child has some hemoglobinopathy. For that, which one of the following statement is correct? I will read again. Prenatal diagnosis of thalassemia trait. Prenatal diagnosis of thalassemia is must if both parents are thalassemia trait or first child has some hemoglobinopathy. For that, which one of the following statement is correct? Options are
correct statement.
Correct. Which statement is correct? Mutation analysis of couple and index case should be known. Mutation analysis of only index case is required. Mutation analysis of any one not required. And mutation analysis of only mother is required. Again, I read for you. Mutation analysis of couple and index case should be known. Mutation analysis of only index case should be done. Mutation analysis of anyone not required, and mutation analysis of only mother can be required or can be done. Your time starts now.
I feel
A.
A, I think.
Yeah, A.
Okay.
Team leader.
Our answer is A.
Okay, so I am locking the answer of mutation analysis of couple and index case should be known. Please confirm the answer. Aman sir. Abhinandan, congratulations, you have scored very perfectly in this somewhat tricky questions. Carle sir, तुम्ही काही explanation देणार याच्यावर?
Yes, sir. This answer is very correct. We know there are more than 200 mutations and many mutations are not that common. So we may miss out some mutations if we proceed without doing mutation analysis of a couple as well as index case. So that should be available. And most important, whenever we see a child having some thalassemia or some hemoglobinopathy, significant hemoglobinopathy, we should that time only try to do the mutation analysis of that child as well as the couple. Because sometimes if they come to us in a next pregnancy, that too say after 10 weeks of pregnancy, that we have a really short time window and all these tests are costly tests. So then many a times because of not availability of funds and time, the pregnancy crosses 20 weeks and then we cannot do much. So whenever we see a first case of thalassemia or any like such disease, we should try to diagnose completely, not just doing HPLC, but total diagnosis with mutation analysis. That will be the best thing, a practical thing for every of us.
Thank you, Dr. Carle sir. We are moving on to the fourth question for the team. This finding is seen. Options: A, sickle cell disease, B12 deficiency anemia, iron deficiency anemia, thalassemia intermedia. Your time starts now.
मैम सेकंड वाटत आहे का बी?
बी प्लस और आयरन
मैम
डेफिशिएंसी
मैम बी
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 B,
B.
B. Our answer is B.
B na, B for Bombay. Okay, so answer we checking your answer with our team.
Hey, they confirm B or D? What is
B
Bombay or what?
B sign B. B12 deficiency anemia. Yes, there is hyperpigmentation of the. You are perfectly right. So you are scored 10. Congratulations. Let us confirm with our scorer, madam, please.
Team Robert has done very well. They've cracked all the questions. Their score is 40.
Okay, congratulations, Team Robert. So I'm moving ahead with the team James Bond. Like I say, Marathwada, are you ready? आमचे थोडे हेमंत गंगोले सर जे आहेत क्वेश्चन वाले थोडे थकलेले आहेत, मध्येच ऑन करून टाकतात क्वेश्चन्स. पण टीम प्लीज एक्नॉलेज टीम मराठवाडा.
Yes sir. Yes sir. Yes sir. Yes sir.
प्लीज व्हिडिओ ऑन करा, हाय करा. तुमचा टीम लीडर कोण आहे? टीम मेंबर्स कोण कोण जॉईन झालेले आहेत?
Sir, myself Dr. Shilpa Darge.
And
my team members Dr. Pratna, Dr. Sachin Jetliya, Dr. Nandakishore sir.
Okay.
And fifth member sir, I was not seeing sometime
Dr. Anil Sagare had joined earlier, madam.
Oh yeah, he had joined, but now he's not.
Okay. At present, only 2 of are there.
3.
We 4 of us are there.
4.
Okay, ठीक है. Who is the team leader?
So myself and my gynec colleague Dr. Pratna.
Okay, no problem. Correct.
Okay. Who is going to answer this question? Question 1. Okay, let us have a team
after discussion.
Okay, this is a question for you on the screen. A 6-month-old child present with anemia, hemoglobin 8 gram% with mild hepatosplenomegaly, no icterus. His CBC was microcytic and post-transfusion HPLC shows HB of, let's say, fetal hemoglobin of 30%. What is the most likely diagnosis you want to rule out? First option, sickle cell disease. Second, beta thalassemia major. Third, iron deficiency anemia. Fourth, sideroblastic anemia. So this child was present the anemia, 6-month-old with hemoglobin 8 gram%, hepatosplenomegaly, no icterus, and transfusion was given, and HbO was saving 30%. So what is the diagnosis possible? Sickle cell, beta thalassemia major, iron deficiency anemia, or sideroblastic anemia? The time starts now.
Beta cell major.
Beta cell major.
Beta cell major, sir.
Okay, so team leader, I can confirm this answer. Beta cell.
Yes.
B. Okay,
Yes,
your
sir.
answer is B. Let us confirm this. Yes, you are perfectly right.
Thank you, sir.
So there, you have scored 10 marks. Friday sir, थोडं एक्सप्लेन करा काय आपण कशाला ब्लड ट्रान्सफ्यूजन बिफोर डायग्नोसिस दिलं तर काय होणार आहे पेशंट्स मध्ये?
So in beta thalassemia major, if we give the blood transfusion, then report may comes normal, and we may have a diagnostic dilemma. And as they require transfusion within month, next transfusion within month, then again we cannot do HPLC in that patient, and then there is a confusion in the diagnosis. Okay, so in any patient, if you want to give blood transfusion, before blood transfusion, please try to get HPLC done so that we can diagnose hemoglobinopathy.
Yes.
Okay, thank you. So moving ahead with the second question for the team James. Hemoglobin is a tetramer. It has heme and globin moiety. Globin part is contain 4 polypeptide chains. 2 chains are alpha chains, 2 are non-alpha chains. So hemoglobin A0 has one of the following combination: alpha 2 beta 2, alpha 2 gamma 2, alpha 2 delta 2, none of above. Your time starts now.
Answer none नाही वाटतं ना रे?
न सर पाहिजे ना A0 म्हणजे अल्फा चेन फॉर्म होत नाहीयेत ना, बरोबर आहे ना सचिन सर?
नन नाही सर. नन का ब्लॉक करू का?
करा.
Answer D none. Answer D none.
Okay, so answer D. Let us confirm. काय आन्सर आहे सांगा सर, हेमंत सर. अच्छा, आन्सर तर आमचा अल्फा टू बीटा 2 आहे. आपण क्वेश्चन परत वाचूयात. हिमोग्लोबिन इज अ टेट्रामियर, हैज a heme and globin moiety. Globin part contains 4 polypeptide chains. 2 chains are alpha, 2 are non alpha. तर A0 म्हणजे मेजर जो हिमोग्लोबिन आपल्यामध्ये असतं अडल्ट मध्ये, तर त्याचा असं अल्फा टू बीटा 2. तर करेक्ट तायडे सर, बरोबर आहे ना हे?
तर बेसिकली HbA म्हणतात त्याला. HbA0
हा सर, HbA0 तर नाही ऐकलं सर.
ओके.
A0 एंटिटी आम्हाला माहित नव्हती.
सर हो सर, A0 एंटिटी माहितच नाही, त्यामुळे ते अल्फा नॉन एक्झिस्टिंगच वाटत.
It's okay. Now you get the though you not score at this time, but you got the answer now. Okay. So moving on to the third question for you. A 16-week pregnant lady came with the NCOPD for prenatal diagnosis of beta thalassemia. 16-week pregnant lady came to NCOPD for prenatal diagnosis of beta thalassemia. 16-week. Which state should be done at this gestation? A. Chronic villus biopsy sampling, amniocentesis, non-invasive prenatal test. D. Prenatal testing not possible due to advanced gestational age.
शिल्पा मॅडम बी सांगा.
हो.
Time starts now.
So answer is B. So we will go for answer B.
B for Bombay.
Yes sir, amniocentesis.
Amniocentesis. Let us confirm it. So fast is answered. It was full toss question, I think. So perfectly right. You are scored 10 marks this. Sunita madam, please note. Congratulations. We are moving with the fourth question for the team James. If husband and wife both are thalassemia trait, then what are the chances that their child will be genetically normal? Option 25%, B 50%, C 75%, D 100%. Your time starts
जेनेटिकली
now.
नॉर्मल.
A
जेनेटिकली नॉर्मल म्हटलंय. Genetically normal.
Genetically 100% normal is 25%, but if you consider carrier, then it is 75%. They are genetically normal. They are only carrier.
Phenotypically नाही म्हणलं, genotypically. Answer A sir, we'll go for A.
A देऊया.
Okay, I will locking the answer A then. 25%.
Yes.
Right?
Yes sir.
Okay. So and so if both thalassemia trait are, then 25% of chance having the thalassemia major, 50% having thalassemia minor, and 25% chances of having genetically normal child is C. Congratulations, perfectly scored. Right.
Thank you sir.
So भाग्यश्री मॅडम, काही एक्सप्लेनेशन याच्यामध्ये बरोबर आहे काय? क्वेश्चन फ्रेम केला ना आन्सर?
हो बरोबर आहे, कारण इट्स अ ऑटोसोमल रिसेसिव्ह डिसऑर्डर. सो in every pregnancy there is a 25% chance of having a normal child.
Thank you.
So that again has to be brought across to them properly. It is not 1 in 4 pregnancies. It is in every pregnancy that there is a 25% chance.
Okay, right.
Yeah.
Point well taken. So congratulations team James Marathwada. Scorer madam. And ये बोर्ड की स्कोर सांगा जरा.
Right. Team James has scored 30 in round 1.
Congratulations. So all the best for that round 2. Let us call on the dais team Linus, Mumbai Konkan. They are waiting. Normally Mumbai हे नंबर 1 असते लिस्ट मध्ये, एवढी तर लास्ट आलेली आहे. चला डॉक्टर सुनील, डॉक्टर अमित. झोप नाही आली ना सगळ्यांना? जरा उशीर झालाय, सॉरी फॉर दॅट. थोडं लेंदी आहे, but very important. Only team which are the team members your? अमित दिसता, सुनील, अमित. 2 अमित आहेत का?
हो आहेत.
अजून कोण आहे? डॉक्टर शैलेंद्र सर इज इन युअर टीम?
Yes, he is there.
And
Rajendra Chavan.
okay, so everybody is there. So are you ready then?
Yes.
Okay, all the best. There is a question on the screen for you from our master bowler, Dr. Hemant. A full-term well child with hemoglobin 10 gram% at age of 2.5 months without any hepatosplenomegaly. CBC shows normocytic, normochromic picture with hemoglobin, fetal hemoglobin of 40%. with one parent thalassemia trait, other normal. What is the most likely diagnosis? A, beta thalassemia trait, beta thalassemia major, physiological anemia of infancy. Option D, sickle cell disease. Your time starts now.
अमित सर ए बोलना चाहिए.
Amit sir, A. Yeah.
C. Yeah, I think it's C. I think it's C.
Yeah, but fetal
C.
hemoglobin is 40%. Huh?
It's normal for that age.
See, there is one parent is straight.
Team leader, answer.
Normostatic.
C for cat. Okay, let us confirm with our
Dr. Jack, please confirm that option.
Option confirm करा. Team leader.
C, sir, C.
Okay, team leader कौन है तुमचे?
Sir, Amit Jain. Amit Jain.
Okay, I will confirm the C, physiological anemia of infancy. Let us confirm with our software. Perfectly right. This sickle cell usually present late, and this thalassemia trait and major both have the microcytic anemia. Here is a normocytic anemia. That is, sir, please explain this. Congratulations, scored 10 marks in this.
They are the right one, and we have already given the reason behind that. So I think we should go with the next question.
Okay, next question. Question 2 for the team. Interpret the CBC of 15-year-old male child. I read for you. Erythrocyte count 4.33, hematocrit 40.5, MCV 93.7, and this RDW width is 12.4, and RD is a distribution width, right? With the 14.90. Again read for you. Erythrocyte 4.3 आहे, hematocrit 40 आहे, MCV 93.7 आहे, and RDW जे आहे, that is a 1.90. What are the options here? Diagnosis is a beta thalassemia trait, alpha thalassemia trait, whether is a normal, is a microcytic anemia. Your time starts now.
Sir, C. Normal वाटतं.
Normal.
Sir. Confirm. C, sir.
So Amit sir, to be normal, C for cat choose केलेला आहे. So let us confirm with our software whether the answer is right or wrong. Okay, perfectly right. So your answer is correct. We are moving ahead with the third question for you. Both parents genetically diagnosed HBD trait came for prenatal counseling. What advice you will give? Option A, as both are trait, risk of severe disease to the baby, so requires chorionic villus sampling test. No risk of HBD homozygous baby. All child will be affected, so don't conceive. Option D, may not need invasive test, but refer to geneticist for the counseling. So both parents are genetically diagnosed with HBD disease, D trait. Came for the prenatal diagnosis. These are the following other options. The time starts now.
Amit bhai. D, sir.
Actually, D. Yeah, I would go by D.
So team leader sir.
D followed by A once she gets pregnant.
Yeah. D, homozygous HBD are not.
Okay, D. I will log the answer. D, may not need invasive testing, but refer to geneticist for the counseling. Right?
Yes.
Okay.
As of now, yeah.
Okay. Confirm answer. Hemant sir.
Dr. Jay, I heard two options. What was the
D,
option?
D,
Yes.
D, sir. D.
Okay.
D. Confirm D. Oh. So these are the perfect answer you are given. Congratulations.
But sir, Dr. Jay, I would just like to add one thing, that as of now, prenatal counseling. So D is the right option. But once they plan a pregnancy, CVS is required.
Never.
Actually, sir, homozygous D is not severe disease.
Okay.
Tide, sir.
Expert want to explain?
Yeah, expert, and they have said rightly कि homozygous D is not a very severe disease. So they may not require severe testing, but of course we should explain the parents about what. So they must require the visit to the genetist for the counseling.
Thorough counseling is the must.
Okay. Okay. Thank you, Tade sir. We're moving on to the fourth question. Yes. The finding as shown is seen in options: sickle beta thalassemia, sickle cell trait, beta thalassemia trait, homozygous HBD thalassemia. Your time starts now.
Sir, A लग रहा है.
Looks like
Pallor है.
Pallor है.
Sickle beta thal. Yeah.
looks like
Only
A.
Okay, team leader
Answer
sir.
A, sir. Answer A, sir.
A for apple is a confirm answer. Right.
Yes.
Please, Hemant sir, confirm it. Yes. As they already mentioned the answer box, congratulations. Other condition doesn't cause severe anemia.
Oh.
So, scorer madam, please confirm kara.
Yes,
Score.
doctor. I will confirm with of all the teams. At the end of the round one, Vernon team is at 40, Fritz at 20, Mendel at 30, Robert at 40, James at 30, and Linus at 40. So Vernon, Robert and Linus are at 40. Followed by Mendel and James at 30, followed by Fritz at 20.
So, just update the score.
Yes.
I will take a small break and came usually within 2 minutes. तुम्ही कोणाच्या ब्लेसिंग घ्या हेमंत सर तोपर्यंत कोणाचं राहिलं असेल तर डिग्री आणि कोणी पण एनी टीम लीडर हाऊ इज गोइंग ऑन फॉर एक्झाम्पल एक टीम लिनस आली देअर अमित जैन सर तुम्ही आहात का किंवा सुनील कसं चाललंय क्विज आणि काय तुमचे इनपुट्स तुम्ही देऊ शकता तोपर्यंत
एक्सलंट क्विज एक्सलंट चालू आहे काही फक्त काही क्वेश्चन मध्ये थोडस डिस्पॅरिटी वाटली म्हणजे बेसिकली ए आणि ओ जो होता ना एओ HbA ऑलवेज इट इज नेव्हर HbAO त्यामुळे त्यांना एक क्वेश्चन ग्रँड करायला हरकत नाही माझ्या मते
नाही HbA असतं ना ते HbA is of two means basically on evaluation it is two types. HbAO is your standard HbA which you consider and then there's one HbA1. So always in your HPLC report, you will get a AO, that is a A0, and a A1, which is also A1C, which you check that glycated hemoglobin. No? So it is the correct terminology. A0 is A0 and A1 together make A.
Any of the office bearers of MAHAIP is there, they want to express something, they can for 1 minute, and we will go to round 2. Please. Any of them? Because I am sharing, I am not able to see. Dr. Neha, is anybody there?
No, sir, I cannot see anyone.
So, Dr. Naresh Tade, sir, you are taking round 2. So, just start, please.
Okay, sir.
So, we invite Team Warner to this second round, round 2. So, Team Warner, North Maharashtra. Yes, Dr. Naresh, sir.
Welcome, Team Warner.
Yes, sir.
And best of luck.
Thank
you, Dr. Rahul
Thank you,
is going
sir.
to lead the team, Warner.
Yes, sir.
Yeah.
Yes, sir.
Just wave your hands to confirm your Team Warner, please. Dr. Naresh, sir, confirm केले सर्वांनी? We will go ahead.
Yes, sir.
Okay.
Dr. Yogesh is there.
Yes, Dr. Naresh.
This is question 1 for Team Warner. while giving blood transfusion to thalassemia patients, bedside leukocyte filters are used. Out of 4 statements, which one is incorrect? First, filters are used to prevent infections like HIV, HBsAg, SCV. B, to reduce leukocyte count, to prevent red blood cell alloimmunization, to prevent febrile non-hemolytic transfusion reaction. Your time start now.
This filter is used to prevent
A.
WBC. So answer is
Answer
A.
is A.
Yes.
Yes,
Sir,
Rahul.
final answer is A for Apple. Filters are used to prevent infections like HIV and HBsAg. It's wrong answer.
Right. So we will ask our computers to display the correct. Yeah, it is right. A, filters are used. This is the wrong answer. Filters are used to prevent the infection. Next question, please. So this is the direct question. You have to, there is no option to this. You have to directly answer this question.
HBSS pattern.
Diagnose the HB electrophoresis report. In this, I will read you the answer. HbF is 15.8%, HbS zone show 82.8%, and HbA2 1.4%. Your time start now.
Okay, so we have to answer the
Directly. Yeah.
Sir,
Sir,
sickle cell homozygous.
Sickle cell.
So sickle cell homozygous is your answer, right?
Yes, sir. Yes, sickle cell homozygous.
Yes. Right. So it is the right answer, as HbS is 82.8% and HB, there is a HbA is absent, so it is a sickle cell homozygous. Right. Yes. You are perfectly right. Next question, please. This question 3 for you. A pregnant lady found to have sickle cell trait and husband was beta thalassemia trait. What you will do? A, no risk of child with disease, so no genetic testing. Karyotyping of fetus to rule out sickle cell and beta thalassemia. Karyotyping of parents to confirm the diagnosis, and prenatal genetic testing to diagnose fetal genetic mutational status. Your time start now.
So I think answer is I feel prenatal genetic testing to diagnose mutations need to be there. It cannot be.
Answer is D.
Yes. So I'll agree with D.
Yes, sir. Yes, sir. Yes,
So
sir.
our
D.
answer is D. Prenatal genetic testing to diagnose fetal genetic mutational status.
Okay. So please log the answer D, sir. Yeah. So it is a correct answer. Congratulations. But this is the 4th question for you and last questions. RDA, that is the recommended dietary allowance for iron in Indian adult woman is. Option are 10 milligram per day, B 20 milligram per day, C 30 milligram per day, and D 40 milligram per day.
Sankleja sir, any answer?
I think it is 10 milligram per day.
It is A. A. We'll go with A.
Okay, sir. Thank you. Sir, our answer is 10 milligram per day.
So I log this answer A if it is correct.
Yes, sir.
It is they are not mentioned.
Please give the answer.
A, sir. A for apple. 10 mg.
You have given the answer. I am asking our answer bank.
Oh.
So it is the 30 milligram day. For woman, it is 29 milligram per day at exact, and for male, 19 milligram per day. Right.
Okay.
So, what is the score for this team?
Sir, the score for this team for round 2 is 30.
Well done, team Vernon.
Thank you, sir.
Yeah.
Thank you, team Vernon. Now invite the next team, please. Yes, Naresh sir.
Team Fritz. Who is the team leader for this team?
Yes, sir. Ready, sir.
Acha, Shailesh sir.
Yes,
okay.
sir.
So this is the question 1 for you. Best of luck to you all. 10-year-old Radhika had severe microcytic hypochromic anemia. Her brother is thalassemia major, B0B0, requiring blood transfusion since age of 7 months. Her parents are worried whether is Radhika, she is thalassemia major or not. Which statement is correct? First, she is non-transfusion dependent thalassemia. She means Radhika. She cannot be thalassemia trait as no complaint till date. She unlikely to be thalassemia major but requires further evaluation to find out cause of anemia. And D, she is anemic as she is sickle cell disease. Your time start now. Sir,
I
time.
think, brother, I think C, I think. C.
She is unlikely to be made thalassemia
C.
major.
So my answer is C. Answer is C.
Yeah. So log this answer C.
Yes.
So you are right. Answer is C. She is unlikely to be thalassemia major, but required further evaluation. Next question, please. Girl, 15-year girl child, come with increasing giddiness, progressive pallor, increasing blackish discoloration of skin. Next, CBC show macrocytosis with thrombocytopenia. What is the most probable diagnosis? A, anemia due to prolonged bleeding in ITP, vitamin B12 deficiency anemia, C, acute leukemia, and D, sickle cell disease.
I think it's a B, no? Vitamin
Sir,
B.
Shailesh, it must be B.
B, vitamin B12.
So
Our
B
answer
or
is
D?
B. B for Bombay.
Okay. Please log the answer B. So you are right. Again, you are right. Answer is B, vitamin B12 deficiency anemia. Next question, please. A family from high-risk community came for pre-marriage counseling as their son is sickle cell trait and hemoglobin electrophoresis, sickle cell trait in hemoglobin electrophoresis. What advice should be given to the family? Option is A, do not marry in same community. B, do not do consanguineous marriage. C, do HB electrophoresis of would-be wife before marriage. And D, do sickling test of would-be wife before marriage. So your time start now.
I think C, no?
C वाटते ना?
C वाटते.
Our answer is C. C for cat.
C for cat. Okay. I ask to log this answer C, and right answer is C. Again, you are right. So
Sir, sorry to disturb, but एक option E पण पाहिजे. Do not get married at all. Sorry, sir. Sorry to disturb.
Sickle cell disease can occur in non-consanguineous marriage or married in other community also. So sickling test for individual counseling may not be reliable, and it is also not able to diagnose beta thalassemia trait or other hemoglobinopathy. And we see many patients with sickle cell and beta thalassemia combination. So it is better to go for the HB electrophoresis rather than just doing the sickling test. Right? So next question and last question for team. This is the recommended dietary allowance for vitamin B12 in Indian men is A, 1.1 microgram per day, B, 1 milligram per day, C, 2.2 microgram per day, and D, 3.3 microgram per day. Your time start now.
Kishore sir.
नाही सर मेन तर नाही माहिती
2.2 सांगूया.
चालेल.
Answer is C. C for cat. Answer is
C for cat. 2.2 microgram per day. Right. So right answer is right. Congratulations.
Thank you.
I got it right. 2.2 microgram per day. Right.
Cool. Scorer.
Yes, they have answered all the questions and the score is at 40.
Congratulations. You have got all the questions right. Now this is for team Mendel. Who is the team leader for this team?
Yes, sir, we are there.
Dr. Parag.
Yes, sir, we are there, Dr. Parag.
Yeah.
Dr. Parag, Sumit, Kanchan, Madam, Sudhir, Saurabh.
So we start with the question 1. And in a child with thalassemia major on regular blood transfusion, chelation should be started at serum ferritin level of first serum ferritin level above 500, serum ferritin above 1000, serum ferritin above 750, serum ferritin above 1500.
So 1,000, na?
Yes, it's 1,000. Our answer is B, serum ferritin above 1,000.
So please log answer B from team Mendel. So right answer or right, you are right. Next question, please. So this cardiac dysfunction is very important cause of ICU admission and mortality in thalassemia major patients. Which of the following is best investigation to diagnose cardiac iron overload? A, ECG, B, 2D echo, C is T2 star cardiac MRI, and D is serum ferritin. Your time start now.
So our answer is C, T2 star cardiac MRI.
Yes, sir.
Okay,
Yes,
so
sir.
please log the answer C, T2 star cardiac MRI. And you are right. Answer is T2 star cardiac MRI. Congratulations. Question 3 for Team Mendel. Patients come for counseling that out of their 3 children, first is beta thalassemia major, second is thalassemia minor, third child is now 3 days old. Prenatal testing was not done in this child due to lockdown. What is the true statement for third child condition? First, this child must be thalassemia trait or normal. B, as this child doesn't require blood transfusion till date, so he is not thalassemia major. C, HPLC can 100% diagnose whether child is affected or not. And D, only genetic test can tell us whether child is affected or not at present.
तर डी करूया सर.
डी हो
D's करावं लागेल कारण he's 3 days old.
हा 3 days old आहे म्हणून डी फॉर दिल्ली करा सर.
Delhi.
Yes,
sir.
D for Delhi.
Answer D is locked from team Mendel that only genetic test can, and you are right. Only
Yes,
genetic test can tell us whether this child is affected or not. Can Dr. Richa Mishra ma'am tell something about this?
Yes, since this child is only 3 days old, it's too early to say this. The child will still have his HPF related. So answer D is correct. Genetic evaluation if you want to pick up a thalassemia major.
Thank you, ma'am. Thank you, ma'am. Yeah. Question 4. Question 4 and last question for team Mendel is lifespan of normal adult RBC is 45 days, 60 days, 90 days, and D is 120 days. Your time start now.
120 days, yes, sir?
हाँ sir.
Yeah. Yeah.
हाँ, sir.
Option D, 120 days.
So answer is
120 days.
is D, 120 days. If it is right answer, yes, it is right. 120 days. Again, congratulations, Team Mendel, for excellent presentation.
Yes, Team
Good,
Mendel
sir.
has scored 40 in round 2. Well done.
So, sir, if you are going to present this, Team Robert, or I should continue?
Continue, sir. Sandeep is doing. Sandeep is there. Dr. Sandeep.
No, sir. Continue, Naresh, sir.
Yes, Dr. Naresh.
So this is for Team Robert. Question 1. Who is the team leader for Team Robert?
Yeah, Dr. Seema present.
Achha, Dr. Seema madam. So this is question 1 for Team Robert. The following 3 iron chelating drugs, which one is preferred in patient with CCF? First, deferisorox, deferriprone, deferriprone infusion, and D is deferriprox and deferriprone.
C, ma'am.
Madam,
D.
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 D for Delhi.
Shall I lock it?
Yeah, ma'am. C, ma'am. Deferriprone orally देतात.
नाही मला बी वाटते.
मला C वाटत आहे. C.
Final answer. Final answer.
B.
Final answer, ma'am.
B.
So it is B. Should lock by the team Robert. I will request. So the answer is C. Unfortunately, you are wrong. So answer is C. It is the desferriprone infusion because child in CCF. So we require to give the infusion of this iron chelating agent. Next question, please. So you have to give the direct answer in this question. Diagnose the HB electrophoresis report. In this HB electrophoresis report, HbA is 63.8, HbA2 2.4, and HbS 33.8. So your time start now. You have to give direct answer. There is no
Sickle cell anemia.
Sickle cell trait.
Trait, madam. Sickle cell trait.
So what is your answer? Sickle cell trait. Yeah. So your answer is your answer is right. Sickle cell heterozygous or sickle cell trait or sickle cell carrier, as HbS is less than 50%. Next question, please. A 23-year-old sickle cell disease patient conceived pregnancy while on hydroxyurea. What advice can be given to her? Option A, terminate the pregnancy. B, continue pregnancy and hydroxyurea. C, can continue pregnancy and stop hydroxyurea. D, do chorionic villus biopsy and fetal karyotyping. Your time start now.
Madam,
C, I think. C.
Okay.
My answer is C.
What should be the answer? C or D?
C.
C for cat?
Yeah.
Okay.
C.
So please lock answer C. So right answer is right. You are right. The patient on hydroxyurea can continue. Can Dr. Shailesh sir say something about this question? Shailesh sir. Okay, we will continue with the next question. Okay. Question 4 is recommended dietary allowance for folic acid in Indian adult male is A, 1 milligram per day, B, 100 microgram per day, C, 200 microgram per day, D, 300 microgram per day. Your time start now.
B, 100 microgram per day.
100 microgram.
No, ma'am, it's 300, I think.
So this is adult male.
B or
Yeah, 300, D, option D.
D. Answer is D.
D. So D answer, please lock the answer D. So right answer is, so it is D, 300 microgram per day. Right. Congratulations.
Team Robert has scored 30 in round 2. Well done.
Yeah. So next team is Team James. Who is the team leader for Team James?
Yes, sir. We are in.
Dr. Shilpa, madam.
Yes, sir.
Okay. Your other members are also present?
Yes, sir.
Yes, sir.
Yeah. So we start with the question 1. Question 1 is 10-year-old with diagnosis of hereditary persistent of fetal hemoglobin has came with anemia and hepatosplenomegaly. What is the true statement in this case? First, or A, HPFH can present late with severe anemia. B, he is not HPFH but thalassemia major. C, parents HB electrophoresis testing and or genetic testing required for diagnosis of thalassemia and HPFH. And D, he cannot be thalassemia intermedia So other causes of anemia should be ruled out. Your time start now.
आपण आन्सर डी लॉक करूया का?
का नसेल मॅडम थॅलेसिमिया इंटरमिजिएट असू शकतं ना लेट प्रेझेंटेशन
असू शकतं आन्सर
बी पण नाहीये कारण ते थॅलेसिमिया मेजर नसणार आहे ए किंवा सी
बी सर बी.
So B or D?
B.
B.
Bombay.
B for bat.
Yes.
So answer given by the team James is
10
B.
year old is wrong.
No,
sir.
Already
Please give the correct answer.
No, time has already been end. What was the option last given that you take? Now don't ask the answer.
Sorry, we did not.
They have given the option B.
That's
We have to we have to
Answer is
give the
wrong.
right answer. Right answer in this is C. Parents hemoglobin electrophoresis testing or genetic testing required for diagnosis of thalassemia and hereditary persistent of fetal hemoglobin in this case.
Expert want to say something? Dr. Bagesh is there.
This 10-year-old.
Dr. Bagesh is there. She wants to comment anything on this.
Yeah, C seems to be the right answer. Generally, HPFH is a benign condition. But came with the diagnosis means somebody had diagnosed, looks like. Now that he has anemia and HS-Megali, he will require a thorough testing.
Okay, thank you. Dr. Naresh, sir, continue.
Yeah. So next question for team James is. So this is a direct question and you have to answer it directly. There are no option in this case. So diagnose the HB electrophoresis report of 21-year female. HbA is 94.6, HbA2 is 4.3 and HbF is 1.1. So your time start now. So you required to give the direct answer. No option in this.
Thalassemia intermediate answer करूया.
Trait.
Trait madam, trait.
Thalassemia trait.
Thalassemia trait, sir.
So thalassemia trait is the answer given. So your answer is thalassemia trait. You are right. So this is the HbA2 is 4.3. So this patient has a thalassemia trait. Next question, please. So this is severe anemia in pregnancy is said to be present when hemoglobin is below dash gram per deciliter. Option is option A 5, option B 7, option C 9, and
5 severe la 5
7.
B 7.
So what is the
B.
B or D? B.
Sir.
B for bat.
Yes, sir.
Okay,
Yes,
so
sir. Answer.
lock the answer B. Answer right. So answer is B, 7 gram per deciliter. Next question, please. And this is the last question for
Iron deficiency anemia.
most common cause of anemia is A. Iron deficiency anemia, B. B12 deficiency anemia, C. Sickle cell anemia, and D. Beta thalassemia.
A.
Sir. We'll go for it.
If we lock A,
Yes.
yes,
Yes, sir.
sure.
Yes, sir.
Answer is A. Iron deficiency anemia.
Excellent.
So congratulations, Team James. What is the score, madam?
Yeah, the score is 30.
30. So well done, Team James. Next team is Team Linus. So who is the team leader? Team leader?
Yes, sir.
Dr.
Yeah.
Amit Jain, sir. Okay, sir.
Yes.
So question 1 for Team Linus is a 16-year-old female child with severe normocytic macrocytic anemia.
Normochromic, sorry. Normochromic macrocytic.
Her brother has sickle cell disease requiring intermittent blood transfusion. Her parents are worried whether she is sickle cell or not, which is true option. A, she is not sickle cell disease. B, she cannot be sickle cell disease as normocytic anemia. C, she can be sickle cell disease and require HB electrophoresis testing. And D, she cannot be sickle cell disease, but other testing for other causes of anemia are required.
C.
I think it's C.
C लग रहा है
C
C.
for cat.
D.
No,
So
no,
what-
C लग रहा है.
No, C.
C or D?
C.
Amit
for
sir.
cat.
Team leader.
C, sir. C.
So C is the option. So please lock answer C. She can be sickle cell disease. So you are right. She can be sickle cell disease and required HB electrophoresis testing. Next question for team Linus. So this is the direct question and you required to be answered directly. No option in this. So diagnose the HB electrophoresis report. HbA is 57.3, HbD is 40.8, and HbA2 is 1.9. So your time start now.
HBD trait.
HBD trait.
Yes.
Should we say HBS trait also because D and S have the same region?
No, what should
But
be the
they have
answer?
a
Give one answer.
HBD since eluted
HBD
at D.
trait. So please log this answer. Please give answer. So it is the HBD heterozygous or HBD trait. Right. Next question, please. Arman, suffering from thalassemia major, was treated successfully by bone marrow transplant in childhood. Now he came with his wife for prenatal counseling. What advice should be given? Option A is no need to check wife status as he is cured. He means Arman is cured. To check wife by HPLC and or HBB gene sequencing. C, do directly venous sampling or amniocentesis. And D, nothing required to be done as he is completely cured. Your time start
B.
now.
D. Sir, B Bombay.
B for Bombay.
B for Bombay. Okay, so we have to log B.
Yes.
Please log B. So you are right again. If our expert want to say something about this.
Dr. Bhageshri, Dr. Ruchira, Dr.
Yes, sir.
Kanvinde.
Yes, sir. So B is the correct answer because sometimes when we treat bone marrow transplant patients, we can actually be converting them from a thalassemia major to a thal trait. That depends on the HB electrophoresis of the donor. So just because he's had a BMT does not mean that, yes, he's been cured of his thalassemia major, he could still be a thal trait. But the other thing is that with most of our bone marrow transplant patients, we generally tell them that they'll probably be infertile. So I'd be very surprised if they actually manage to have a pregnancy.
Yes.
Yeah. So
They can go for the other modes.
yeah, they can go for other forms of pregnancies, but I'd be very surprised if they have their own.
They get
children.
an option. True.
So next question for team Linus. You are doing as per WHO cutoff points for diagnosis of anemia in adult male is option A 10 gram per deciliter, option B 11 gram per deciliter, option C 12 gram per deciliter, option D 13 gram per deciliter. Your time start.
13.
C, I think.
Sure, sir.
C.
No, adult. C, sir.
So what should be the answer? C or D or D?
D.
Please clarify. Amit sir.
Sir,
Amit sir.
D.
D.
I think C.
D or C? Please.
We heard D. We heard D, sir.
D.
We heard D. We'll take answer as D.
D. Okay. So D. Please give. That is the right answer. 13 gram per deciliter.
Okay.
Congratulations, team Linus, for wonderful performance. Score, please.
Yeah, team Linus has also scored 40. They've answered all the questions. This is even in round 2, they have scored 40. Well done.
Dr. Jay and Dr. Sunita, please give the total score and
Okay.
then yes.
We go for the rapid fire then. I'll start with Team Vernon has scored. Total score is 70. Fritz is 60. Mendel at 70. Robert at 70. James at 60 and Linus at 80.
So it is a tough competition, and you have to. The last round is going to be a very wonderful round.
Dr. Jay.
Yeah.
Dr. Jay, you can discuss amongst yourselves. Just give me 1 or 2 minute break, and till that time, Dr. Jay, please explain all regarding this rapid fire round. Okay.
Yes, sir, but there is 80.
Sir, I have one query.
Yes.
Sir, hydroxyurea is contraindicated in pregnancy actually.
Ma'am, I can take that question as well. Hydroxyurea should ideally be stopped 3 months before conception is planned.
Yes.
However, if it is not stopped, unless you actually document a congenital malformation, you can continue the hydroxyurea. They've done studies to show that it really does not have that many teratogenic effects. Yes, it's known to be a teratogenic agent.
It is cytotoxic.
Yeah, but it's there have been studies to prove that if it's not been stopped and you've conceived, you can actually just make sure that the child doesn't have congenital malformations and then continue the pregnancy forward.
Okay.
So you don't need
But
to terminate.
actually, madam, the most practical suggestion would be to terminate if possible.
Sir, unless you document congenital malformations, actually now people are saying don't terminate the pregnancy.
Don't terminate the pregnancy if the mother is already pregnant on hydroxyurea. Terminate only if you diagnose or see some congenital malformation. Yeah.
That's true.
Okay, we are moving ahead with the rapid fire. Already the some rules for rapid fire. Maximum 1 minute and maximum 10 questions. And you decide among yourself who is going to answer to me, because I cannot hear from the 4 people. I have to concentrate only on one person, and either you have to attempt the question or say pass. Unless until say pass, you are not attempting pass, then I can go for the next question. And there will be 5 marks for the correct answer. So you can attempt maximum 10 marks here. Now our question banker is back with after physiological break.
Whether that question was clarified, hydroxyurea.
Yeah, clarify. We're moving ahead. We're late. Hemant sir, rapid fire कौन शुरू करता है? 60 टीम है.
Just sir, a question, sir.
हाँ.
Sir, if we say pass, can we again re-answer that question?
No.
Okay.
Then pass is gone. Right. Simple.
Sir, one more thing. Suppose we finish all the 10 questions, like maybe pass or answer the question. But if we have time left, can we re-attempt the?
No re-attempt. Only one attempt.
Okay.
Thank you. So team Vernon is ready. Me चालू करे काय question?
Dr. Jay, माझा आवाज बरोबर येतोय?
येतोय.
So I will be going for rapid fire round. Probably everything has been explained to you, and so we will go to first team. That is Team Vernon, and
Team Vernon ready?
Yes, sir.
Rahul, you are going to answer all questions?
Yes.
You can discuss with the team. Right. I will take your answer only.
Dr. Jay, you will be doing rapid fire round because my screen is getting blocked.
Okay.
So you will be taking.
Total rapid fire मला घ्यायचंय.
Total तुम्ही घेऊन टाका कारण माझ्याकडे हे स्क्रीन मध्ये
इंटरप्शन. The team Vernon is ready. You will as if timer चालू होईल, क्वेश्चन चालू झाले की चालू समजायचं. First question for the team Vernon.
Ready? All the team is set. ठीक आहे. We'll start.
Yes, sir.
We'll start.
Yes, sir.
Okay.
Which globulin chain is deficient in alpha thalassemia?
Alpha globulin chain, sir.
Commonly, the RBC size in beta thalassemia is described as
microcytic size, small size.
HbA2 is increased in which nutritional anemia?
Iron deficiency anemia.
What is the dose of blood transfusion in sickle cell disease patients with acute splenic sequestration crisis?
Dose of blood transfusion in disease.
Sir, we can go up to 15 milligram.
10 ml per
We
kg.
can go up to 15.
10 ml per kg, sir.
In thalassemia major patient, after how many transfusion chelation drugs are started?
After 10 transfusion.
Okay,
One
so
minute is over.
you are attempted the 5 questions. First question was पूर्ण करा घ्या पुढे. So which globulin chain is deficient alpha thalassemia? Correctly answer alpha. Correct. Then second was commonly RBC size beta thalassemia T size microcytic. That is also answered correctly. And HB12 increase in which nutrition anemia? You said iron deficiency. Actually, it's increase in the folic acid and B12. And fourth question was attempted. What is the dose of blood transfusion in sickle cell patient with acute splenic disease? It's a 5 ml per kg, not 15 ml per kg. And the last attempted question was, in thalassemia major patients, after how many transfusion chelation drugs are started? After 10 transfusions. That was answered correctly. So, scorer, please note, they have answered 3 questions. They have scored 15 marks.
Yes.
Sunita, madam?
Yes, noted.
Okay, thank you. So the next team is Team Freeze. Gangule sir, freeze झाले का तुम्ही? Gangule sir. Okay. Gangule sir. Are you ready, sir? Team Freeze.
Yes,
Captain.
Dr. Jay,
Shailesh Patil sir.
hear me?
Yes,
ready
yes.
आहात? Yes, I am concentrating you. Your rapid fire starts now. First question and timer, please.
Hello.
Hemant sir. First question on the dais for the team freeze. Rapid fire. येतोय.
हॅलो, आवाज येतोय? नाही स्क्रीन होत आहे. हा, ओके. सो फर्स्ट राउंड मा किती झाला स्कोर? 15 ना? ओके.
So team freeze, are you ready? Shailesh sir?
Yes.
Hemant sir, first question. Start rapid fire for them. Which globulin chain is deficient in beta thalassemia?
Beta.
Second question, फटाफट. Commonly sized RBC in alpha thalassemia is
Microcytic.
क्वेश्चन हळू येतात.
हेमंत सर पटपट क्वेश्चन घ्या पुढे.
टाइम द्या आम्हाला जरा.
हो देतो, काय काळजी करू नका. टेक्निकल हे दिसतंय. 1 मिनिट. काय होतंय? We are restarting again. परत टीम फ्रीज, थोडा टेक्निकल एरर येते तिथे.
Hemant sir, you are more clear than the question, sir. Can you continue with the same?
Yes, I know. परत आपण रिस्टार्ट करूयात फ्रीज साठी. ऑलरेडी हे झालेलेच आहे. 2 क्वेश्चन्स परत.
एक म्हणजे काय प्रॉब्लेम येते माझ्याकडे. यू आस्क नेहा टू शेअर अँड स्टार्ट फ्रॉम दिस रॅपिड फायर.
ओके, नेहाला फोन करावा लागेल. तुम्ही फोन करता का?
येस, आय विल रीड.
1-2 मिनिटा. विल कॉल समबडी टू शेअर फॉर अ टेक्निकल एरर येते. 1-2 मिनिट. आपण जरा त्यांना काय ते टेक्निकल एरर इज देअर.
नेहा मॅम ना मी फोन करू का सर?
हा, हे पण करतायत मला वाटतंय त्यांना.
नाही तर मी ट्राय करते.
मी पण करू शकतो, माहिती. 1 मिनिट. एवढा लॉंग क्यूज आहे त्याच्यामुळे दिस एक्सपेक्टेड सम. आता व्हायला लागले खरंच. हेमंत सर,
आवाज येतोय जय?
हा, आला. आता व्यवस्थित चाललंय.
हा, ते चालू करा, परत चालू करा. चल,
परत चालू करा. ओके, टीम फ्रीज प्लीज.
हा, रेडी.
या, रेडी. सॉरी फॉर टेक्निकल डिफिकल्टीज. यस, प्लीज स्टार्ट सर. बॉलिंग मशीन. हेमंत सर थकले जरा.
2 questions are answered, so I.
ओके, ठीक आहे. विच ग्लोबिन चेन इज डिफिशियंट इन बीटा थॅलेसेमिया?
बीटा.
ओके, नेक्स्ट. तुम्ही पटपट घ्या हेमंत सर. Commonly sized RBC in alpha thalassemia is
microcytic.
At HBS position, which other hemoglobin is eluted in cellulose acetate electrophoresis?
Pass.
Sir, E द्या. HB.
Which dose of penicillin is between 1 to 5 years as per recent IAP standard treatment guidelines?
250 milligram per day, twice a day.
Okay. What is the dose of deferricerox in patient with beta thalassemia and iron overload?
20 mg per kg per day.
Metformin should be stopped before pregnancy. True or false?
False.
Okay, your time ends. So you are attempted 6 questions and 3 were correct. Just will confirm the answer for these 6 questions. Which globulin chain is deficient in beta thalassemia? You said beta, that is correct. Commonly size of RBC in alpha thalassemia microstatic, that is correct. At HBS position, which other hemoglobin is eluted in cellulose acetate electrophoresis? HBD is the answer. What is the dose of penicillin V? 1 to 5 years. As per the IAP standard guidelines, you said 250, actually this is 125 BD. And what is dose of deferricerox in patient with beta thalassemia and iron overload? Is a, you said 20 mg per kg. Actually, dose is 20 to 40 mg per kg. So,
sir, can be correct, sir? 20 mg.
I will ask Taide sir. Taide sir, काय करायचं आहे? Expert. Taide sir, are you there?
Say 20 milligram per kg per day and then OD. Then it is completely right answer, but they say just say 20 milligram, so we cannot consider that it is as a complete answer.
Okay, then metformin. Then next question was attended was metformin should be stopped before pregnancy. True or false? They said false. That was correct. So that the score 4 correct answers. Scorer, please note.
How many correct answers? 3.
20 marks. So team well played, team freeze. They scored 20 marks. Please note, scorer madam.
Yes,
Three, sir.
3.
Okay.
3 questions only, sir.
Sir, only 3 were correct.
नाही त्यांनी बीटा पहिला ग्लोबुलिन चेन वाला बीटा बरोबर आहे, मायक्रोसॅटिक वाला बरोबर आहे
आणि फॉल्स.
आणि हा बरोबर आहे. देअर स्कोर ओनली 3. 15 मार्क्स घ्या मॅडम.
Yes.
Sorry. Moving ahead with the team Mendel. Are you ready? Team Mendel, please.
Yes, sir. We are ready.
Yes.
I am Dr. Parag.
डॉक्टर जय, पहिले 6 मधले कुठले राईट होते ते सांग परत.
कशाला मी लिहिलंय 15 मार्क. चला पटपट पुढे आता.
नाही सांग.
नको. बीटा बरोबर होता, मायक्रोसायटिक बरोबर होता. फर्स्ट क्वेश्चन राईट, सेकंड क्वेश्चन राईट, अँड मेटफॉर्मिन 6 वॉज राईट. 6
बरोबर. ठीक आहे.
लिहिलंय मी. चला आता प्लीज
सर बाकीच्यांना म्यूट करायला लावा ना सर.
हा हो डॉक्टर पराग आर यू रेडी?
Yes, sir. We are ready.
हेमंत सर आर यू रेडी?
Yes.
Okay, please start. Team Mendel, your sickle cell anemia is due to mutation in which globin chain gene?
Beta globin chain.
Which commonly hemoglobinopathy which HbA2 is more than 10?
Sickle cell thalassemia trait.
Yes, sir. Thalassemia trait.
Transcranial Doppler for stroke screening in sickle cell disease should be started at what age?
After the age of 10 years. 10 years.
Which common organism leading to aplastic crisis in sickle cell?
Parvovirus beta 19. Parvovirus beta 19.
Which predominant type of hemoglobin in late stage of gestation?
Fetal hemoglobin.
Yes.
AC inhibitor should be stopped before pregnancy. True or false?
True.
विचारा
Next question.
पुढचा मी विचारेल, what is the maximum time for the which drug treatment for spermatogenesis can be given to thalassemia major men for induction of spermatogenesis?
What is the maximum time for which drug? Pass.
Sir, 1 year.
No.
1 year.
1 year.
You are attempted almost 7 questions. The first question was sickle cell anemia is due to mutation in which globin chain gene beta is the correct answer. Which is the common hemoglobinopathy with HbA2 is more than 10? You said trait. Actually, it is HbE. Then transcranial Doppler for the stroke screening sickle cell disease should be started. You said 1 year. Actually, it's a 2-year age. Then which is the most common organism leading to aplastic crisis sickle cell disease? Parvovirus B19 infection is the correct answer. Which is the predominant type of hemoglobin in late stage of gestation? That is fetal hemoglobin. That is also correct answer. And AC inhibitor should be stopped before pregnancy. You said true. That is a correct answer. And last is what is the maximum time for the drug treatment of the spermatogenesis can be given to thalassemia major men for induction of spermatogenesis? Actually, this is 2 years. So you attempted 7 and 4 are the correct answers. You scored 20. Congratulations, Team Mendel. Gangulia sir.
Thank you, sir.
Congratulations, Team Mendel. Next team is Team Robert.
Ma'am, should I answer?
Yeah, you can answer.
Madam, लिहितायत ना 20 मार्क. कोरल मॅडम 20. Yes. Team Robert, Gangulia sir. आले का परत थोडं गडबड होते दिसते त्यांच्या काहीतरी.
Ready?
Yes.
Sir,
Are you ready?
Yes. Sagar, Dr. Sagar will answer.
सीमा मॅडम तुम्ही टीम लीडर आहात, तुम्ही अटेम्प्ट करणार सगळे क्वेश्चन.
Sagar, Dr. Sagar.
I will.
कोण अटेम्प्ट करणार आहे?
Sir, Dr. Satish Ghatod.
सतीश तुम्हाला व्हिडिओ ऑन करा सर जरा.
Yes, sir, just a minute.
Yes, okay. Dr. Satish, I am concentrating you. Are you ready? Hemant sir, are you ready?
Yes.
Question on the dice, please. Please start the rapid fire for Team Robert. HB thalassemia is due to change in beta globulin change at which position?
Beta globulin. Pass.
What is the ratio of alpha to non-alpha chain in normal person?
4:2.
Within what time child with sickle cell disease and stroke should receive a blood transfusion or exchange transfusion?
As soon as possible.
As per WHO cutoff points for diagnosis of anemia in children of 6 month to 6 year age is
11.
Uh,
11.
The gamma 4 tetramen are also known as hemoglobin.
Bart.
टाइम थोड़ा कमी होता तो एक क्वेश्चन एक्स्ट्रा क्वेश्चन्स घ्या. डॉक्टर हेमंत प्लीज नेक्स्ट क्वेश्चन्स मध्ये वेळ गेला होता एक 2-3 सेकंद. silent carrier of वाचून दाखवतो. Silent carrier of beta thalassemia is A2 level is below 3.5%. True or false?
True.
Okay. Yes. So they are attempted 6 questions. So you answered 3 correctly. I will read for you. HB thalassemia is due to change in beta globulin change. At which position? Not answered. The position is 26. What is the ratio of alpha to non-alpha chain in normal person? Yes, to 1:2. Actually, is 1:1. Within what time child with sickle cell disease stroke should receive the blood transfusion or extend transfusion? You said immediately, which is practically impossible. You said within 1 hour should get. Fourth is what is the WHO cutoff point for diagnosis of anemia child of 6 months to 6 years? Answer correctly, that is 11 gram%. And gamma 4 tetramer, also known as hemoglobin BART, that is also correctly. And silent carrier beta thalassemia has a HB level of less than 3.5%. You said true, and that is the correct answer. So you are answered 3 correct answer. Team Robert, well played. Madam, please note kara.
Yes, noted. 15.
They have scored 15 marks in rapid fire. Thank you. Next team is Team James, Marathwada.
Yes, sir.
So team leader is Dr. Shilpa, madam. Are
Yes,
you
sir.
ready? Okay.
Yes, sir. Sachin, should I answer?
Yes.
Okay. James घ्या. गंगुले sir.
Pratna ma'am, comfortable है ना? Please, you do help in between.
Yeah, obstructions I will tell you.
Yeah, ma'am, sure.
Yeah.
Team James.
Sir, questions.
Questions. 1 minute. Team James, are you ready?
Yes, sir.
Your questions and rapid fire starts now. HBD Punjab thalassemia is due to change in beta globulin change. At which position?
Sachin, Maiti.
Position 6, sickle cell.
6. Position 6, sickle cell. Okay.
Which globin chain is not seen in newborn?
Beta.
Beta, sir.
Which is the most common site for avascular necrosis in sickle cell disease?
Femoral head. Femoral head. Femoral.
What is the ideal hemoglobin S level should be kept to prevent the recurrent stroke?
Less than 30%, sir, in HBSS.
Drug crizanlizumab acts on which receptor?
Sir, selectin, sir. Selectin. I think selectin, sir. Beta selectin, sir.
Chorionic villus sampling had lower is than amniocentesis. True or false?
False. Sorry, true, sir. Sir, higher risk, sir. Coronary sampling.
False.
So
false. Answer is false.
What
False
should
answer,
be the pre-transfusion hemoglobin kept in thalassemia major pregnant women?
9 to 10.5.
Yeah, 10.
Okay. So you attend the questions. Almost 7. HBD Punjab thalassemia is due to change in beta globin change. At which position? It is actually first base of 120 on codon. This is quite tough questions. Not answered. Which globin chain is not seen in newborn? That is actually
beta hai. Delta.
Then that third answer was correct. That is the most common site of avascular necrosis, sickle cell, hip joint, femoral. That is correct answer. An ideal hemoglobin should be kept to prevent the recurrent stroke in HB, the sickle cell. That is the 30%. That is correct answer. Drug crizanlizumab acts on which receptor? P-selectin. That was correctly given. And coronary villus sampling at lower is than amniocentesis. Actually, all that is also correctly given. And you said 9.5 to 10.5. That is, sir.
Can be given.
Can be given. Okay. So they are attended 7 questions and 1, 2, 3, 4, 5. So they are attended 25 marks. Score ke liye congratulations. Team James. Almost you point blank. तुम्ही James Bond सारखे खेळले आहात. Congratulations.
Thank you, sir. Thank you.
Thank you, sir.
And Team Linus, Mumbai, Konkan, are you ready? Sunil, Amit.
Yes, sir. Yes, yes.
Okay.
Ready.
Yes, I am going to concentrate on Amit Jain then. बरोबर आहे. Okay. Dr. Hemant sir, ready आहात का? हेमंत सर अनम्यूट करता ना जरा. होय नाही काहीतरी बोला.
Yes, sir.
हेमंत सर.
Ready. Yes, ready.
Ready, chalo, start. Is the team ready? Rapid fire for team Linus.
Yes, sir.
सुनील गावस्कर आणि अमित आहेत.
Yes, चला.
आम्ही तर तयार आहे. आमचे जरा कॉम्प्युटर थकले आता. In sickle cell anemia, glutamine is replaced by which amino acid?
Valine.
थोड़ी गड़बड़ होते, ठीक है. हेमंत sir, which globin chain is more in late fetal life?
Beta globin, sir.
Beta.
Which is the first screening test for HBE thalassemia?
Sir, either HB electrophoresis or HPLC.
HPLC.
थोड़ा वेळ देऊ हा, थोडं काहीतरी स्लो होतंय ते. Since what age ophthalmic screening in sickle cell disease should be started?
10 years of age, sir. 10 years.
Hemant sir, which new drug is approved for sickle cell disease in more than 5 years age?
Recently sir. So, sorry, sir. Voxelotor.
Sickle cell trait has higher rate of complication than normal pregnancy.
False.
अजून एक क्वेश्चन घेणार तुमच्यासाठी. नेक्स्ट क्वेश्चन प्लीज. हेमंत सर, त्यांचा वेळ गेला होता जरा. At what gestation stage aspirin should be started in pregnant sickle cell disease women?
As soon as, sir.
14 weeks.
14 weeks.
14 to 16 weeks.
Sir, your rapid fire ends here. You also attempted seven questions. In sickle cell anemia, glutamine is replaced by which amino acid? You answered correctly, valine. Which globin chain is more in late fetal life? That is a gamma. You said beta, that is actually gamma. Which is the first screening test for HB thalassemia? That is a DCIP test, dichlorophenol indophenol test. And at what stage ophthalmic screening for sickle cell disease should be started? You said 10 years. That is the correct answer. Which new drug approved for sickle cell disease more than 5 years? That's L-glutamine. That's the Enderi. Sickle cell trait has higher rate of complication than non-pregnancy. You said false. Actually, it is true. At what gestation age aspirin should be started in pregnancy? At women, actually the answer you said 14. Tide sir will decide. Actually, the answer is 12 weeks. Tide sir, 14 ला द्यायचं का 12 ला द्यायचं?
We can give 14 also.
Okay, ठीक है. So,
काय 14 से practically आपण 14 ला चालू करतो.
No issue.
Sorry to interrupt. It should be started with the onset of pregnancy, not even 12 weeks.
No.
Before 12 weeks.
8 weeks or 10 weeks.
एक मिनिट. Tide sir.
Expert, Dr. Bageshwari.
Given is 12 weeks, so we can consider 14 week also because difference is not much.
Actually,
But
the
if we
first
give
visualization is at 12 weeks. So ideally,
In the guideline, it is 12 weeks.
So we will ask the hematologist if they accept the answer 14 weeks or they say 12 weeks we should be right answer on the.
Dr. Bageshwari.
Yeah, I think we can grant it to the team.
Okay. Experts. So they have attempted 7 questions and they have correctly given 3. So scored 15. Scorer, madam?
Yes. Noted.
Yeah, noted. So we're at the end of rapid fire and we're coming to the end of our quiz right now. Not can say end of quiz. We have to go for the final our score. Give 3-4 minutes for us. Our scorer. because the इंटरनॅशनल क्विज झालेला आहे आपला, तर तो कसं करणार नाही. हेमंत सरांनी डोक्याला हात लावलाय, थोडा गडबड झाल्यामुळे, पण दॅट इज एक्सपेक्टेड, राईट? इट्स ओके. वेल डन, फंटास्टिकली वेल. स्कोरर मॅडम, तुम्ही फायनल स्कोर सांगा.
येस, the final score, congratulations all the team. I will go to the final score. Team Vernon, total score is 85. Team Fritz, the total score is 75. Mendel is at 90. Robert is at 85. James at 85 and Linus at 95. So, sir, you're going to put it on the chart?
No.
Okay.
We are not going by. You just you can tell the bifurcation once again. Round means Vernon 40 plus 30 plus 15.
Yes.
Okay.
I've checked it, sir. You want me to tell it again?
Yes.
Okay.
Once
Sure.
more.
Vernon team and in round 1 scored 40. In round 2 scored 30. And in round 3 scored 15. So that comes to 85.
Yes.
Then Fritz in round 1, 20. In round 2, 40. And in round 3, it is 15. So they have scored 75 total. Mendel in round 1, 30. In round 2, 40. And in round 3, 20. So that comes to 90. In Robert team has scored 40 in round 1, 30 in round 2, and 15 in round 3. That gets to 85. And team James, 30 in round 1, 30 in round 2, 25 in round 3. So that goes to 85 total. Linus in 40 in round 1, 40 in round 2, and 50 in round 3. That goes, the total score is 95. So you are going to declare?
No, our expert will declare. Before expert declares, we can have words from them. The experts were Dr. Bageshri, Dr. Kanvinde sir, Dr. Ruchira. We will have their comments first, and then we will ask them to declare who is the winner.
एक्सपर्ट आहेत का? बराच लेट झालाय. ठीक आहे.
नाही, डॉक्टर बागेश्री आहेत, त्यांना आहे दिसत आहेत त्या. त्यांचे कमेंट्स घेऊया, रुचिरा मॅडमचे कमेंट्स घेऊया आणि मग त्यांना दोघांना सांगूया विनर डिक्लेअर करायचं.
Sir, before the expert, can I say something for academic interest?
हे डिक्लेअर करायचं अगोदर.
Okay.
एक विनर आपण डिक्लेअर करून टाकूयात.
नाही, after their comments and after the declaration, we will take the inputs from whoever wants to say something. So Dr. Sailendra, we will come back to you.
Okay, sir.
Yes.
स्कोर फायनल स्कोर सांगा, म्हणजे आपल्या बागेश्री मॅडम डिक्लेअर करतील.
नाही, सांगितलं त्यांनी ऑलरेडी.
तुम्ही डिक्लेअर करा.
नाही, ऑलरेडी.
I just want to say that I applaud the efforts put in by the coordinators of the quiz, Dr. Naresh Taide and Dr. Sandeep Karle, and of course the quiz conductors, Dr. Jay Bhandarkar, Dr. Himan Gangulia, because it really takes a lot of effort to compile questions, get the right answers, to conduct. So I really applaud the effort taken by all of y'all, and it was quite an interesting quiz. As always, some of the questions in a quiz are always a little dicey, but I must also applaud the participants who really made it a very closely fought contest. And I hope we have more such quizzes in the future. So congratulations to all the participants, as also to the winning team. Thank you.
I will just second Dr. Bhageshri's words. I've thoroughly enjoyed it. I've been sitting in this seat for the last 2.5 hours, just glued to the screen, and I've been getting comments from all over the family saying that what is happening? Why are you not leaving this place? And I told them, this is so interesting, I can't get up. So thank you so much for organizing this, to the organizing team members, and thank you for the participants to make it such an interesting program. So congratulations to the winner, but I think everyone needs to be congratulated for putting in their efforts. Thank you so much.
Very close contest.
So experts to declare the winner is, you must have heard the scores.
Yeah, I think Team Linus deserves the standing ovation for this. They've done a really good job out of it. But
runner-up.
Yeah,
runner-up.
All of them are very good. Sir.
Yeah, but Team Mendel also did extremely well. So I think they are second position probably.
Yes.
And 3 of them are tied at 85.
Yeah, all 3 at 85. So,
hello.
Anyone?
Lost you.
Any expert is there? Any expert is there?
Hello.
Yes. Dr. Sandeep. कोण बोलतोय?
कुठला अजून संपलाच नाही का कार्यक्रम तो?
So our winner of today's quiz, as a MAHAIP president, I already declared by the experts, but once to reiterate, the winner is Mumbai Konkan. Hearty congratulations to them, as well as the runner-up is the Mendel team, that is West Maharashtra Zone 2. So we will take the comments from there. This team leader of this West, of course, we will take from all one line. We will start from the Varnan team, North Maharashtra Zone. Team leader. Only one line.
We really enjoyed the whole session, sir. It was very interesting. Not a single minute we could move our eyes from the screen. Bearing some technical difficulty, it was a very well organized program. Thank you very much, Maharashtra IAP, for conducting such an excellent quiz. And it was a lot of learning things. So many things we could learn today.
Okay, thank you. Thank you, Dr. Rahul. West Maharashtra Zone. West Maharashtra Zone.
Hello.
Yes. Dr. Sailesh.
It was a great experience and learning. And I thank all my gynec and pediatric colleagues for joining me. And thank you, MAHAIP, for conducting this quiz. Thank you.
Vidarbha? Vidarbha? Team leader Vidarbha.
So it was very nice. It was fantastic. But in the rapid fire, actually, I felt there was we could get more questions. Actually, we were faster, but we could have covered 10 questions also if there was no technical difficulty. Otherwise, it was fun.
Marathawada.
Sir, it was a great experience, great efforts put by all the organizers. Thank you, MAHAIP, for this effort. We really enjoyed. I would thank all my team members also for my score, I would say. Sir, except for this quiz, I don't think we would have read these topics in such details. So it's really, I work as an assistant professor in MIMSR at Latur. So it was really good. Thank you, sir.
West Maharashtra. Zone 2.
Yes, sir. Thank you so much. It was a very great quiz. I thank you all my team members, and from my team, I thank you MAHAIP for choosing us as a part of this quiz. Thank you so much, sir.
And Mumbai Konkan.
Mumbai Konkan. Amit was great, and
yeah. On behalf of our team, I would like to thank everybody. It was an amazing contest, and we know how difficult it is to compile the cases and questions. And as rightly said, the technical difficulty was there, but then that's a part of the game, so we have to bear with it. Well done, excellent, and everyone was participating. I see everyone's still there, so that tells that everyone enjoyed the quiz thoroughly. Thank you so much.
Extremely sorry for that technical difficulty, because it all depends on technology. Probably a little bit problem occurred, but still I think so we could cover, and the Jay has the mind thought of giving extra time to those team who cannot because of technical difficulty. But still I think so everybody have covered that, so many questions. If our technical team, and then we'll go to Dr. Sailendra. Our technical team, Dr. Sunita Madam.
It was fantastic. Quiz masters were excellent. The questions were very good, and the team's hats off to them. Takes a lot of courage to be here. Great going. Thank you.
Thank you, Madam, for having with us and putting all the scores properly and correctly. And Dr. Abba Sahib is there. Abba Sahib is there. Dr. Neha. Dr. Neha, Dr. Abba. Till the time they, yes, Dr. Neha.
Yes, sir. Congratulations. I will congratulate all the teams. Well played. And It was a fantastic quiz. It was a first time for me in this participation and all, but it was fantastic and enjoyed.
Yes, Dr. Sailendra. And then open to everybody, anyone wants to comment. And then last final word will be from Dr. Joy, and then we will close down. Yes, Dr. Sailendra.
Thank you, sir. First of all, congratulations to the team to organize such a fantastic program on a big scale. And congratulations to my team, Dr. Saxena, everyone. Just a couple of academic points I would like to add. In the sickle cell valley case, so I now having worked in the field of high risk and critical care obstetrics for the past 20 years, more than 20 years, I personally have never found a patient of obstetric complication because she's sickle cell or THAL. They behave like a normal patient. If they have to undergo an obstetric complication, that's more because of uterine atony and proper obstetric reasons. So that's one thing I would not agree with. Secondly, aspirin personally should be started, I think, at 14 weeks. Those are guidelines, as Madam said, they rightly said 8 weeks. But what happens is, invariably, these patients start bleeding. And then we are in a confused state, whether it's a bleeding of abortion or whether it's bleeding of aspirin starting or what. So that's the reason practically we start between 12 and 14. That's the couple of points I would like to add. And the last thing is the between CVS in prenatal diagnosis, between CVS and amniocentesis, both have its own pros and cons. The risk of abortion is more with CVS, but the risk of infection is more in amniocentesis. And the termination, if required, is easier at earlier stage. So amniocentesis is easier for the management part. CVS is easier for the management part, and amniocentesis is difficult because second trimester termination is difficult nowadays. So these were a couple of points, but otherwise excellent conducted quiz. Thank you.
Thank you very much. Anybody wants to have their views, comments?
Yes, sir.
Yes.
Yes, sir. Dr. Kanchan here, Kanchan Durkar. I want to congratulate all the quiz master and all who have organized this. It was excellent. Being a gynecologist, actually sickle cell and thalassemia we come across very less. I am in the IVF practice, so very less, but it was a revision. And being a Pune obstetric gynecologist member, I will actually suggest this idea to actually incorporate pediatric in our next upcoming events. So it was just learning. It was a great learning experience, and we look forward that we will include pediatrics branch in our upcoming event. Thank you so much.
So Susamvad between obstetrician, gynecologist, and pediatrician.
Yeah.
So Dr. Pratna here, I would like to thank all of you for giving us this opportunity, being associated with pediatricians. Fortunately, previously Dr. Sandeep Karle had told me about this, that we will have something ongoing between FOXY and IAP. And Dr. Rajendra Pardeshi sir was here, who is president of Maharashtra OBGYN Society now. So definitely on that state level, we can start working on some guidelines for all these things. And what Dr. Karle sir had told in his one of the questions when he was clarifying, as a fetal medicine expert, I would really like to add to that, as a pediatrician, if you find any child with thalassemia, please ask them to get the genetic analysis done, because what he told was exactly right. Many times these women come to us in pregnancy that around 4th or 5th month of, and that time because the genetic analysis is not done, we start from the proband, if that is alive, then the parents, then the fetus. So this, fortunately now the time of MTP has been increased to 24 weeks, but still to go for abortion at 24 weeks is not good. So if my pediatrician colleagues here have done that part, that at least tell the patient that first thing is you need to complete the genetic diagnosis, and secondly there is some cost involved, because at that last moment it is difficult for them to spend all that amount. It's very short span of time, and the pregnancy is advancing from MTP point of view. For us it is difficult. So if the genetic diagnosis is done, then definitely we can offer the CVS at earliest at 11 weeks also, which is definitely useful. Because CVS and MDO doesn't make a difference for us as a fetal medicine person to do procedure. But unless the genetic reports are in hand, we can't offer them CVS. We have to tell them to wait till 16 weeks before the amnio, just for the sake of having the reports in hand. And the second factor comes here is if the proband is on thalassemia for transfusion dependence, then we can't take the sample of the proband after transfusion. We have to give that 3 weeks time again for us to have the correct genetic test of the proband to be done. So these 3 weeks again go for the genetic test of the first child who is thalassemia major. So that's why all my pediatricians, and not only thalassemia, for that reason, I, as a fetal medicine person again, if you have any child where we can suspect a metabolic disorder, if you suspect any genetic association, at least keep the parents updated that before planning next pregnancy, they should meet a fetal medicine person. So we can at least put them on the track that you need these tests, what is the cost involved of the proband, and again the prenatal tests, because all these genetic tests do have some, big figures to deal with. So that's why. So thank you.
Thank you, madam. Naresh, do you want to react? Naresh.
Yeah, not actually react. First, I want to request every participant कि please do your HB electrophoresis, your eligible family members HB electrophoresis. Let's start from ourselves. We should be role model for the society. If we don't do our HB electrophoresis, our family HB electrophoresis, then we cannot counsel the parents or their relatives to do HB electrophoresis before marriage or before pregnancy. So start from ourselves. And as madam says, 3 weeks is required for after blood transfusion, but for genetic testing, it can be, we may not require to wait that much because leukocytes are used, and we can do after 3 days or 7 days also, just not on the same day of the transfusion, but we can do before 3 weeks also. Okay, and that is madam have correctly pointed out कि genetic testing is must. We have seen some cases who treated as thalassemia for 12 years, 16 years, and later at that age they diagnosed with the diamond black vein anemia, and second child is with only with steroid. He is well without transfusion. That child also received transfusion for 12 years with diagnosis of thalassemia major. So this may happen.
Thank you, Dr. Naresh. If you want to add something, otherwise, Abba Sahib, and then lastly, Jay Kumar. Abba Sahib Patankar, is he there? Anyone wants to say? Otherwise, we will go to Dr. Jay Kumar for vote of thanks and what. Yes, Dr. Kishore.
Yes, sir. Just I will like to add, like Dr. Kanchan said, many thanks for involving gynecologist sir in this, and hats off to the organizing team because you also did a test run, and that's why this was a success. So though your people are so busy, thanks for all this. And just one academic point I will say, sir, the future will be pre-implantation genetic diagnosis, because those children you are seeing in OPDs, their parents, if they are traits or affected, that is coming now. Pre-implantation genetic diagnosis will be there for yes for all these hemoglobinopathies. Yes, thank you.
I just want to speak something, sir. Can I?
Please.
It was I really thank the organizing team for involving gynecologists, and especially me, because I am running a thalassemia daycare center, and I have so many children, about 62 children of thalassemia, which we give free blood transfusion to them. So the many questions, many things I was not knowing, and many things are uncovered for me, and it was really helpful. So I thank the team for involving gynecologists. Thank you very much.
Sir.
Mumbai Konkan side.
Sir, good evening. Actually, for private practitioners, it is a great learning because once the thalassemia is diagnosed with us, most of the patients go to district hospital for further transfusions, and then almost never come back to us, unless very affluent class that also go for bone marrow transplantation. So it is a great learning. Maybe after my postgraduate thalassemia day care center at KEM, I have read thalassemia after a long time. So it is.
Yes, Dr. Jay. I think so. Conclude all the things.
Okay. at last. So thank you all participants for this great response to this beautiful subject, because as a doctor and pediatrician or healthcare workers, I know we should know in and out, and you should spend much of your time, daily time. For some time you must give thought to the some academics and practical academics. So I thought it's a great subject to have a quiz on it. And thanks first specially to Dr. Naresh Taide sir from Amravati and Sandeep Karle sir from Parbhani for framing all questions, and as well doing all this final PPT animation, Dr. Hemant Gangulia and Dr. Amol, what to say, contacting all the participants and arranging all the teams, and even thanks to the experts, Dr. Seth madam, then Dr. Ruchira, Dr. Kanvinde sir for giving their precious time to this important event. And thank to my MAHAIAP team, office bearers, for always supporting all these activities. And thanks to Vishal, Neha, still they are with us and doing fantastic job. Still 4 or 5 months are remaining and going to game with the wonderful ideas for this. Please join all MAHAIAP programs. And this Dr. Sunil is smiling a bit. He knows कि क्या activity होने वाला है, मुझे मालूम है. So again, congratulations all that. For winner and losing is not important. We are taking our knowledge to next level, right? It is about the sensitizing ourselves for saving our own kids, because the only prenatal diagnosis is the only intervention, suppose done for not all thalassemia major or sickle cell, any other disease, kahenge ki that's the GDP of the nation is depend on that. So taking care of mother and the child is diagnosed, able to diagnose the child before it's born, and definitely going to help world a lot. Almost we have 1 lakh thalassemia patient, 1,50,000 sickle cell patient all over world. And unfortunately, all these kids are born in the low middle class and tribal areas, which unfortunate people, they don't have access to the healthcare services. So better we start thinking about this and help our own kids, our own families, ourselves, our families, to go for prenatal diagnosis or screening ourselves, so that we can prevent not a single child of thalassemia major should born in India. That's what the long-term aim is there. So thank you all of you for this supporting this event, academic event, I can say some different kind, because sometimes attending webinars can be boring, but learning in this phase almost we covered a lot, right? And I'll also learn a lot of things in this. So thank you very much for participating in large number, and do attend our activities. They are going in around the clock, but acknowledge them, attend them, and enjoy the academics with MAHAIAP. Thank you very much. Good night.
Thank you very much. Good night.
Bye bye.